Maverick News presents The Rick Walker Show. Defrag your mind.
Oh my goodness. I am slow on the mark tonight. Okay, there. Now that's off my face and you can hear me and you can see me. Sorry about the seeing part. Do my best to beautify myself before I come on here. Welcome back, everybody. I'm Rick Walker. You're watching the Maverick News Channel. Welcome, Maverick family and new viewers. The world is watching, and we're excited to have you here. And we have an exciting guest here tonight. Chaplain Paul will be along momentarily. He is the gentleman who phoned in the other night during the phone-in portion of the program and was talking about issues with the healthcare system in the United States. And, of course, by extension, there are conversations to be had about the Canadian healthcare system as well, and healthcare in general, and the dignity of, for patients and advocating for people who really aren't in a position or don't have enough support or the ability to speak for themselves. That's what Chaplain Paul will be speaking to us about tonight. He's an activist, a healthcare activist from Phoenix, Arizona, and we're privileged to have him join us here this evening. We'll also get into the news of the evening at some point. We'll probably talk a little bit about what's going on with the Russian response or anticipated Russian response to the attack on that bridge in Crimea that we talked about last night. There were some charges laid in connection with fake electors in Michigan, Republicans related. All this is related to the Trump campaign, surprisingly. So we'll talk maybe about that. And there in Las Vegas, there was a search of a premise related to the Tupac murder from like 30 years ago. So that's a pretty surprising development in that case, but there is no statute of limitations there on homicide cases. So it's not clear where that might lead. I'll tell you where we're going to lead, though. We're going to lead right back to Chaplain Paul right after this.
Greetings, brave Mavericks. Our quest for truth continues. We go beyond fake news. Together we expose propaganda. Together we pull others out of rabbit holes. We are maverick thinkers. We are all unique individuals, defenders of individual rights and freedoms, credible, trusted, grounded in reality. Maverick News, Maverick News. Defending free speech, free speech. Donate. at freedomreporters.com. Do it now. Tomorrow may be too late. Maverick News. The world is watching.
And so are you. And joining us now is somebody else who's coming back. We talked to him on the phone the other night, and now we have his smiling face on the screen. Hello, Chaplain Paul.
Hello,
How are
Rick.
you?
Thank you. Thank you, sir, for allowing me to appear on your show. And I greatly appreciate it. And I give you a lot of respect, sir. And thank you very much.
Thank you for taking the time to appear on the program. It's a privilege and an honor to have you here. I'm excited to have this conversation because you truly do give a voice or provide a voice for so many people who really can't speak for themselves. Let's just kind of rewind and go back to where you first got involved in this health advocacy that you're involved with down in Phoenix, Arizona.
Well, I'm sure you don't have about 10 hours, so I'll try to compress it into a small package for you. Back in the 90s, my parents were very poorly treated in our healthcare system here in Arizona. My parents were basically lied to and ripped off and taken advantage of. And we spent 4 years of living hell dealing with the lies and the just being misled and just a web of the way the healthcare system works. We were totally unprepared for it. My mother, she had Crohn's disease in the 60s. She grew up, had that as a young girl, and she had a series of operations in the 60s and then had operations in the 80s, had an operation. By the time the 90s hit, it's a whole different ball game. And so, after my mother and father died, I became a healthcare activist. I didn't want this to happen to other people. Most people, when their loved ones go through, our healthcare system and they're treated very poorly and they pass on, the attitude of most people is, well, they want to put it behind them. They just want to put it behind them and move on. They want to forget about it and move on. It is a very painful thing. I don't like having to bring up these memories all the time, but the fact of the matter is, my core values is not to let it go. My core values is our family got hurt. I don't want others to be hurt. And I've been fighting back ever since. And, I've been involved with the Alliance for Retired Americans. I was heavily involved with protesting George W. Bush's Medicare prescription drug bill. I heavily involved with our elected officials. And eventually I did 2 years in Kingman State Prison on a drug charge from 2008 to 2010. Became a leader in the Church of Kingman, saw miracle after miracle. I'm talking inmates healed of diabetes, hep C, cancer, relationships restored, family members restored, all by the faithful prayers of the brothers in Christ in Kingman Prison. And then when I got out of prison, I went through a 2-year chaplaincy program and dove into long-term care ministry, all voluntary. One of the things I started doing back in the 90s was my family makes cheesecakes. So I started making cheesecakes, bringing them into nursing homes, care centers, medical rehabs, and hospitals to show appreciation to doctors, nurses, and staff. So hopefully that love would transcend the quality care of the patients. And, it works. You come in and you give a homemade cheesecake to the staff that's underappreciated. It's a very difficult job, and it brings people to tears. And this is just one of the things. We fight back with love, and we fight back with conviction and righteousness, and we just try to do the best we can so these poor people are treated better. And not only that, it's not only for the people that are in there now, it's for us, Rick. I mean, unless we're lucky enough to die a sudden death, we're going to be hitting them beds someday. And the deal is, by the time we get there, I don't want you to be, I don't want me to be, I don't want my children, and I don't want my family, coworkers, neighbors. I don't want them being in that bed yelling for help in the middle of the night and nobody's coming to help them. I mean, I have patients that wait 6 and 7 hours to be changed, patients waiting all night long to be changed because there's not enough staff at night or on the weekends. And there's no state agency out here that will enforce staffing shortages. So it goes on and on and on. I mean, when you have a situation where patients are waiting hours to be changed, it opens the door for added health problems. It opens the door for added symptoms like MRSA, E. coli, rashes, bed sores, blisters, infections, and other very serious complications. And then what happens? You have a lack of staff, you have more symptoms. Then after with those symptoms comes more treatment. So it's a vicious circle. Give less care. Give the minimum. We get the minimum amount on this planet. Our water is the minimum. Our food is the minimum. The minimum added a daily alliance for X, Y, and Z. Our healthcare, the minimum, and what we get in return is misery. Now, let me be perfectly clear. There are a lot of good, compassionate, loving people in our healthcare system. So I'm not saying there isn't, but their job is to go in there and help people with their physical care. The human condition needs physical care, needs spiritual care, loving care, emotional care with a healthy diet and proper exercise. If you limit any of those equations, you limit the patient's ability to survive. We need love. We need that loving, compassionate care that only family members and friends can give. And that's basically it in a nutshell.
Okay, so you're a chaplain. How did you come to be a chaplain, or what does that involve?
All right. Well, in healthcare, there's different classifications of a chaplain and what a chaplain does. Most healthcare chaplains, what they do is they provide the spiritual and emotional support that a family needs. When my mother and father were sick, and my mother was in the hospital for 4 years, Chaplain Danny was instrumental. We could call him on the phone. He'd pray for us. When a family's in crisis, a chaplain tries to bring calmness and just reason to the situation, tries to calm the family down. This is why when the lockdowns happened and we were all locked out, around the country, they locked out all non-staff members of clergy out of the healthcare facilities. In Arizona and around the country, chaplains aren't required in nursing homes, care centers, or medical rehabs. They're not required. It's all voluntary. You go in, the patient requests it, the family requests it, or like me, I go in voluntary, and the patients that request to visit, we go and visit them. We're not intrusive. We don't have free reign to just go into any room unannounced. It has to be on a Christian visitation list, or anybody in the hallways, free game. But the deal is, what are we there for? We're there to try to bring the love and compassion of Christ to the patients. How do we do that? Through the Word of God, through my own life experiences. The Bible says our pain is our ministry. In Corinthians, it says we are to comfort others to the same degree that we've been comforted by God. When my family was going through it and we were comforted by God, now I could take that experience into these places and comfort these people to the same degree that I was comforted, because I feel their pain. I feel their pain. And this is how we go in and we just share. Like in my case, I'm a writer. I share my stories, my poems. I just try to be a friend, a loving friend to these patients, and try to get them back on a good mental health, a good level playing field, so they don't need psych meds and antidepressants by the time Chaplain Paul leaves that room. They're on a much better state of mental health because they're happier and they have hope. And that's what we do. We bring the hope, love, and of Christ to the patients, so they have a fighting chance for survival. That's about it.
And I guess you have sort of identified, or you continue to identify shortcomings in the healthcare system in your state and the country, and you try to draw attention to these issues. Is that a big part of what you do?
What needs to be is they need to have a national staff to patient ratio. The staff to patient ratio in Arizona is 2 RNs and 4 CNAs for 63 patients. And at night and on the weekends, there's one RN, and sometimes there's only 2 CNAs. The CNAs do the bathing and the changing. So at night and on the weekends, you got an RN that, some of these RNs are very reluctant to help the CNAs. And then you only have 2 CNAs for 63 patients. that's an impossibility to change all those patients. That workload is so it's just unrealistic. So what happens? The patients that are coma, semi-coma, they don't get changed. I have patients that told me if they have an accident at 10 o'clock at night on a Friday, they're not getting changed sometimes until the next morning. So, this is unacceptable. I tell people, we can't have our loved ones, we can't have people that helped us to get to where we are today in society. They can't be treated like zoo animals and prison inmates. You have to have some sort of humanitarian guidelines, and you have to have agencies that actually enforce where these patients are being treated properly. They say, oh, well, we can't get, we can't find good help. This is the industry's argument. You can't find good help because they're not paying. In Arizona, the CNAs in the private facilities are paid about $10 less than the CNAs in the state facilities. So if you're in a CNA, are you going to go for $10 less? No, you're going to go to the state facility. So this is one of the issues. They have to have equal pay. They have to have more stricter laws. They have to have a national staff to patient ratio, which I would say 2 RNs, 4 CNAs per 30 to 35 patients. This will greatly improve the safety and quality of care for those patients.
Are we talking about hospitals or long-term care facilities?
We're talking about long-term care facilities. This makes up nursing homes, care centers, medical rehabs. The quality of care in these facilities it'd be like this. When you're in a hospital, you're like getting Hyatt Regency care and accommodations. You move down to an acute respiratory, a rehab or a nursing home or care center, especially low income. It's like moving from the penthouse to the basement. The wait times are very long, and it's horrific. Pastor Sean was my friend. He was 58 years old. He was a patient in the facility where I serve. I love this man. He became my pastor and friend, and I became his chaplain and friend. All right. In the 3 years he was in the facility, he had to deal with E. coli, MRSA, bed sores, rashes, infections, blisters, and other serious complications that landed him in ICU. And he eventually died on January 2nd because he had E. coli in his bladder. Okay. And he had kidney stones that weren't being treated properly. He had blood clots in his legs that weren't being treated properly. He had to have his toes amputated because the wound team didn't treat an infection in his foot properly. He went into a coma and a catatonic coma. And I went to ICU every day and sat with that man until his wife got down here from Oregon. And 90% of his problems could have been prevented yeah. if he got better care and if state agencies were doing it. I begged every state agency to come in and help this man and my patients during COVID, and they did practically nothing. And okay, go ahead. I'm sorry.
So is this an insurance issue, or are these places publicly funded? What's the situation there? Is that part of the problem? Is it the business model that's failing?
The long-term care facilities are funded by CMS. That's Medicare and Medicaid. That's federal. These facilities make literally billions of dollars are sent to pay for these. The patients that are on Medicare and Medicaid pay for their health care. Subsequently, what happens is when these facilities do not, when they break those CMS regulations, most patients and family members don't know what to do. They don't know who to contact. They don't know what to do. A lot of the times, if it's because of staffing shortages, like in our case down here, the health department, health services of Arizona, and I filed multiple complaints with health services and long-term care licensing department and the long-term care ombudsman, and I called Arizona long-term care adult protective services. And what they'll do is they'll come in and write a report. They'll do an investigation. Those reports from Adult Protective Services and from the Arizona Long-Term Care Ombudsman then go over to the Arizona Long-Term Care Licensing Department, where mostly they're downgraded, dismissed without any investigation. The only time there's an investigation is if someone goes online and files a report backed up by the reports by Adult Protective Services and the Arizona Long-Term Care Ombudsman. That makes their case stronger. Now, here's the deal. If you're going to file complaints, you need those reports from the Adult Protective Services and from the Ombudsman. You need to have those reports because if you're going to sue these facilities, you need those reports. It strengthens your case. All right. So in my experience, Arizona Long-Term Care Licensing Department comes out on site. They do a Mickey Mouse investigation, and then I get a letter, and I have them under my laptop here. I got 4 of them. The rest I threw away. That says, after a thorough investigation, there's not enough evidence to substantiate my allegations. Well, my allegations are I have patients that have bed sores and rashes and developing E. coli and MRSA up all night in their soiled diapers. What more evidence do they need? What do they want me to do? Take pictures? I mean, this is what we got here. You have the lobby of the long-term care lobby that just whittled away at these protections and regulations around the country. Oh, we need more profits. We need more profits. We need more. At what point do you say protection of profits has to stop? You've created a system where it's like a healthcare slave ships. You have a situation where these facilities are being run efficiently, but the patients are treated like animals.
Is this a question of insurance levels? Are all patients dealing with this, or is it just people of middle class or people who are poor? Or what's going on?
People that are rich can get better care. Why? Because if you got the money, or if your family members can pony up the money, you can hire caregivers to go in there. So the caregivers are about $20 an hour. So you do the math, that costs a lot of money. So if you figure, well, there's going to be less staff on Friday at 6 o'clock until Monday morning, well, let's pony up. When would we need mom to have care? Well, we need from probably 6 o'clock to 10 o'clock or 6 o'clock to 12 midnight because she's sleeping the rest of the time. Monday through Friday through Monday morning. And then we have a caregiver come in there and we pay the caregiver to at least be in the room and to go and notify the CNAs and other staff that they need to get in the room and help this person. Another way is you get an attorney and you say, you get an attorney in advance. You have the attorney call the facility day one. Let's say you're a patient, Rick. I'm the attorney for Rick Walker. We're going to be monitoring his care and his treatment. If he has to wait more than 20 minutes to be changed, or if he's being abused, neglected, or mistreated in any manner, we're going to make a record of that. And upon his discharge of your facility, we're going to sue you. I mean, this is basically what we have to do now if we're going to stand up and defend our family, our civil rights, our right to be treated humanely. It's all thrown out the window. Most people, they don't want to deal with this. Who wants to talk about death? Who wants to talk about being in a nursing home? Most people say, oh, I'm not going in there. I'm never going in there. Well, come and talk to my patients. They thought the same thing. And long-term care isn't just for old people. There's a lot of young people in there too. I have patients that OD'd on fentanyl, patients that had stroke, heart attack, patients in accidents. So you have young people that are a mixture of in these facilities too, and they're not being treated properly. I had a guy named John. His daughter OD'd on fentanyl. This man, his wife died. Okay, then his son died. His son had like cerebral palsy and was operated on his stomach because he had a sepsis on his stomach, an abscess on his stomach, and died. So the man lost his wife, his son, and now his daughter was given fentanyl by doctors, OD'd because they cut her off cold turkey. She went on the street, got her fentanyl, OD'd, was in a catatonic semi-coma. And this man came and sat with his daughter 7-8 hours a day because he knew the importance of being in there to make sure she was cared for properly. All right. You got to watch every drug that comes through that door because they make mistakes. I got patients, they're sitting there looking at their drugs. That's ridiculous. You're looking at each pill to make sure it's the right pill. They'll sneak in antidepressants and psych meds that are that are not good for your mental health at all. And it's just a racket for making money. It's just a shame. More people need to get in there and volunteer to be by these people's side, even if it's one person that you say, you know what, I'm going to go in there. You contact the activities director of any of these facilities, say you'd like to come in and volunteer, go in and sit with one person. Your life will be greatly enriched. The stories that they share are priceless. The life skills that these people have are priceless, and you'll receive a joy that is missing in society. The joy of helping others, the joy of volunteering in doing what we're commanded to do in the Bible. I mean, the Bible says very clearly we're to treat others as we would want to be treated. We are to love thy neighbor as thyself. The Lord says multiple times, you are to love others as I love you. Well, if we put that into practice, there'd be nobody alone in these facilities. You'd have people, they'd be surrounded by people who love them, want to take care of them, and be treated properly. That's missing. Love is the answer, and it's just missing right now.
Is this situation, I mean, you're focused on what's going on in Arizona. Do you have a sense of, is this something or similar? I guess it's a similar story in state after state nationally.
Each state has their own methods of enforcement and their own laws. Some states are better than others. You know, let's face it. There are some states that do their job, make sure there's enough staff, make sure that their patients are being treated properly, make sure that the state agencies that are charged with protecting these people actually do their job. Then you have other states where our elected officials have caved to corporate, and corporate comes in and says, well, like in Arizona, there was 4 inspections a year by the long-term care licensing department. What's the like? They come in, the surveyors come in once. Now it's once a year. It was 4 times a year. Then it got whittled down to 3, 2, 1. One inspection a year. That's ridiculous. And these places know when they're coming, so they get everything, spit shined, and they come in during the day. There are no inspections at night or on the weekends at all. There's no state inspectors that go in here unannounced. It's just pathetic. So why did this happen? It happened because as citizens, our job is to keep our elected officials accountable. Our job is to say, hey, you know what, Mr. Long-term care lobbyist, I don't think Senator so-and-so should weaken the regulations and the protections of these poor people so you can make more money. I don't think that's right. The problem is we're not in these meetings because we're too busy. We figure we're going to elect these people and let them go do what they want to do. We don't want to deal with it. You want the job? Go ahead. I'll elect you. If you're Democrat, I'm Democrat. Y'all elect you. You're Republican. I'm Republican. I'll elect you. Don't bother me. Just do your job. And they go off and they cave to corporate greed. They cave to these corporations. They come in and lobby these people. They invite them to their corporations. They wine and dine them. They bring them in and have big ceremonies and give them tours and make them feel great. And the deal is that our elected officials aren't even going into these facilities. I've asked a number of my elected officials to come in and visit these patients, visit the family members. I had one that has agreed, and we're still setting up that meeting. That's a disgrace. That is an absolute disgrace. Our elected officials, they need to be going to the homeless shelters. They need to be going and helping our vets. 23 veterans commit suicide in the United States a day. We have homeless vets. We have vets that aren't being treated properly. And then we have these people in nursing homes, care centers, and medical rehabs that aren't getting proper care. They're abandoned. They're all alone. They're being treated like animals and prison inmates. And we cannot allow this anymore. So whose fault is it? It's all of our fault. It's all of our fault because we don't want to deal with it. We don't want to deal with this. This is a very hard, sad, in your face subject that we don't want to do. I don't want to have to come to the reality I'm going to die someday or be in one of these facilities, but I don't have a choice. I can't go in and look at these poor people and then go home and pretend it doesn't exist. Okay. I fight night and day for these people because it's not right. I mean, this is just what God has given me, this calling, and I'll keep fighting until the day I die. I've lost too many people. Over the last 2 years, I lost 20 people I love. And that's not including some of the patients and other people that I knew, 20 people. and a lot of them were treated very horribly by our healthcare system. So as long as I have breath, I'm going to talk and fight and keep being involved with trying to create a better system, a more humane system for these poor people. It's the least we can do as human beings.
You've written a lot of books. You have a website. Is that where people can find out more?
I wrote a book called How to Protect Yourself in American Healthcare that has just very easy nuts and bolts, guideline on how to do that. I have written a book called Kingman, The Miracles of Kingman State Prison, The Miracle Book of Kingman State Prison, Fumba the Elephant, Chaplain America series, Chaplain, a lot of my stories. Oh, and Victory Over Suffering Through Christ Our Lord, right here. A lot of my hold on a minute. A lot of my books have the patients in them. One of the ways that I try to cheer up the patients is by writing them into story. It's helped them immensely. I would go in and say, hey, you know what? If you were an animal, what would you like to be? Greg. Greg was a patient I loved. He died all alone in isolation during the lockdowns. He was paralyzed from the neck down. I asked him, if you're an animal, what would you be? He said a turtle. And I was thinking about like a little turtle that, a little land turtle. He goes, no, a sea turtle. Well, that's what he looked like laying in the bed. He looked like a sea turtle. So I created a character called Greg, the humble sea turtle. I put Pastor Charles in my stories, who was a mighty man of God. He was a patient in the facility. Only 1% of people survived what he had through prayer and through visiting this man every day. Praise God, he's home right now. Please keep him in your prayers. He has to have dialysis twice a week, and he's still learning to walk again. A mighty man of God. And a lot of my stories are basically out of love for the patients. I wrote them for my family. Pastor Doug, who I was in prison with, who's now a pastor, he's in my stories. And so, and they're all free. They're free as PDF files. I got to the point, I got tired of trying to promote them. And I was like, I don't even care. I put the PDF files on there. You hover over the PDF. You could download it, keep it, share it. It's miraclesofkingman.com. And it's all free. It all points the way to Christ. There's a lot of good videos on there. And that's what I do, and it's been a blessing to do that. Pastor Sean, I wanted to write him into story, and I made him a superhero. I'm Chaplain America. Okay. Chaplain America is Chaplain John Lionheart, who works at the VA. He's the head chaplain. He's me, but a younger me. And I wanted to create a character for Pastor Sean. So I came up with the Holy Illuminator. He's a man that always says, Jesus loves you and so do I. Many people came in to get counsel and prayer while he was a patient in the facility where I serve. I loved him dearly. He died. The way he died, it brings me to tears. It was unnecessary. And the thing is, I wrote him as the Holy Illuminator, and I made a series of short stories, 10 of them, and I took them around the world. So I would write the story, and I go, Pastor Sean, look, I finished this one. You're going back in time to 1800s in Alaska, because he worked on a boat in Alaska. He's from Oregon, and I wrote him that. And I took him to New York. I took him to Israel. I took him around the world, and it really lifted him up and made him happy. And this is, who wouldn't be happy? Like Rick, if I wrote you into a story and you were in the bed suffering, and I wrote you in, hey Rick, you know what? I made you, the Maverick, the Holy Maverick, and I wrote you into a story, and I come in every week, and I'm bringing you a story, and I'm saying, look at that, and I'm all excited, and I'm showing it to you. That's going to make you feel good. It's better than staring at the ceiling, worried about your health all day. And it shows you that Chaplain Paul loves you, and I'm concerned about you. I want you to be happy. I want you to be cared for properly. And I got your back. And so, and for those out there that would say, well, you're a Christian. Hey, look, this goes for everybody. I had a Jewish man. He was a rabbi, Rabbi Hirsch. We hit it off real good. He taught me a lot of stuff. I loved him. Even if you're an atheist, Chaplain Paul will love you. I won't push the Bible down your back, down your throat. I'll sit with I'll hold your hand and we'll watch Jeopardy together. So this way you're not alone. Okay. This is how I operate. So, that's about it, Rick. I mean, I could go on and on and on for
No,
all day long.
everything you're saying resonates with me. I can on a real level relate to what you're saying because I've been in the hospital. I'm not complaining. I'm grateful. I've been in a position where I wondered if I was going to be able to walk out of the place and, for an extended period, laying in the bed, doing exactly what you've said, staring up at the ceiling, there by myself. And it's scary. It's depressing. It's very lonely. And so what you're talking about, I understand the difference that can make in someone's life. And, I'm very fortunate. I'm back, right? But I remember just looking out the window, wondering if I was ever going to be out walking around on the street again, just free to just stroll down the sidewalk. So I I absolutely understand, and I don't look forward. I fear the day when I'm in that position again. As you pointed out, most of us will be at some point down the road.
Well, let me give you the good news, okay? The good news is that God gives us the capacity to weather the storm out. God gives us the capacity to be alone. And, like David was in the cave alone as Saul was hunting them down to kill him. He found solace in writing the Psalms. And so, through reading the Psalms, through reading the Word of God, through praying to God, you're not alone. God is with you. Christ is with you. And he helps to sustain you through these storms. Pastor Sean, yes, he called me and he had issues and we talked it out on the phone. But here's a man that really loved the Lord and God helped him to get through the horrendous things that he went through. God will give us the capacity to do that, but we have not because we ask not. We're not to fear death. If we know the Lord, we've accepted him into our life, death is not something to fear. What we're talking about here is the dying process. When we go through the dying process to get to that place of heaven and bliss, from the point where we enter into our healthcare system to the point where we go home, either to the Lord or go home to our family, that gap has to be greatly improved. How do we do that? The body of Christ needs to step up. They need to go into these facilities and hold these people's hands, pray with them, sit with them, and protect them. We as citizens need to step up. I tell people a story. The guy out here, it's 115 degrees right now. Okay, that's hot. You go to the store, just walking from the store to your car is brutal. The guy that bagged our groceries for the last 40 years, okay, he may have a little bit of a mental health deficit. The nicest guy in the world. Just sit there. He bags your groceries. He smiles. He says, "How are you today?" He'll walk you out to the car. He'll help to load the groceries. He'll run across the parking lot at 115 degrees to get your cart from you. He's done this for the last 40 years, and now he winds up in one of these places all alone, fending for himself. Nobody's visiting him. This is how we treat people in society that went the extra mile to make sure that we were taken care of, that we were respected. The garbage man, the firemen, our teachers, the people that built your house, where are they today? Your house was built 40 years ago. They're in these facilities right now, all alone. So, we have to say, well, hey, you know what? We need to treat these people better. We need to ensure that their journey through our healthcare systems is one of peace, love, compassion, and encouragement, surrounded by the love of Christ, so that when it's our turn, we can be treated the same way. That's it in a nutshell. Everybody wants to invest in retirement. Oh, we're going to put away money for retirement. When I retire this, retire that. I'm malarkey. We need to be investing in this issue because that's retirement. There's no guarantee you're going to be sitting on the beach in Acapulco drinking Mai Tais all day. The real reality of the food that we're eating, the water has the water has been compromised. Our air has been compromised. Our food, our supplements, our medicine, our vaccines have all been compromised. So the odds are you ain't living till 80, 90 years old. So are we going to have the compassion that we're going to create a system where people get the love and compassion, encouragement they need in order to survive in our healthcare system? Or are we going to continue to just blow it off and pretend it doesn't exist? So that when it's our turn, and I guarantee when it's our turn, we are risking even a worse fate for ourselves and our family if we continue to do nothing and just turn a blind eye to these issues. That's a fact. People don't want to hear this, Rick. They don't want to hear it. I'm sorry. It's the truth. It is what it is. We're big boys and girls, and so we need to just come to terms with this, begin a dialogue, begin talking about it, and begin to urge our elected officials to craft good legislation that's going to protect these people. Go to the church body and open the Bible and say, well, here's what it says. We are to love others as Christ loves us. We are to treat others as we would want to be treated. We are to love thy neighbor as thyself. Well, are we doing that as a church body where long-term care patients are concerned? Are we really doing that? This is what needs to be addressed. I couldn't have said it any better. Thank you, Lord.
So do you have a plan or strategy? Are you pushing for specific kinds of changes, legislative changes, business changes, insurance changes? Where do you want to begin, or where do you think things have to start?
Here's the deal. I'm pushing for a national staff to patient ratio that's more humane, where these healthcare workers are not the caseload is not so just unbearable.
So you're pushing for some sort of a regulatory change,
right? It's
in Arizona.
National, it would be a national staff to patient ratio that's more fair and humane, or even statewide. Each state has their own staff to patient ratio that's heavily enforced by all state agencies. That's more humane. 2 RNs and 4 CNAs per 30 to 40 patients is more realistic than 1 RN and 4 CNAs for 63 patients. That's just ridiculous. And there's no enforcement. The other thing is they need to have a requirement that there be chaplains in all nursing homes, care centers, and medical rehabs. It's required in prisons and hospitals. And for the life of me, I don't know why it's not required in these other facilities. People say, well, if there's a requirement and they can't get chaplains, then what's the punishment? How are you going to enforce it? You know what I tell my elected officials? That's what we elected you for. It's not my job to come up with that solution. It's your job. Here's the solution. You work out the details. Having chaplains in these facilities is critical. A good spirit-filled chaplains that are going to go in and at least be on site. Now, it is a comfort. You bring your family member into one of these facilities and they go down the list of things that they provide. If they say, you know what, there's 2 chaplains that are here a couple of days a week, just knowing that is a comfort. Just knowing that if their family member passes away, or they're saying your family member only has 24 hours to live, that there's a chaplain on staff that will come and in person and be with the family to at least try to calm them down and give them hope. When you don't have that, a lot of people don't know a chaplain. They don't know a pastor. They don't know who to call. So they're left all alone. The other thing is more inspections. So there's got to be at least 4 inspections a year, especially in Arizona. And inspections have to include nights and weekends, surprise inspections. There needs to be state officials that go in unannounced, undercover, and walk around these places during the day and at night and on the weekends just to make sure they're being cared for properly. The Arizona long-term care ombudsman needs more teeth. They used to be the arbitrator that goes into these facilities and arbitrates these type of issues. Now it's been so weakened that they can only solve very, very minimal problems. They can't solve big issues. They have to give the report to the Arizona Long-Term Care Licensing Department, and then it's the Arizona Long-Term Care Licensing Department that's responsible for those issues. A lot of time the issues aren't resolved. There's a whole lot of list of other things that need the food. You can't feed sick, injured people, especially long-term care patients, unhealthy foods. The foods that are mostly served in these facilities are unhealthy processed foods. You can't do that. You have to have healthy foods. I mean, come on. When we were sick, what did mom give us? Did mom give us a hot dog on a plain bun with chips, or did she make us homemade chicken noodle soup? I mean, come on. Healthy foods help to create a better mental health and gives you a fighting chance to survive. It makes you feel better. So healthy foods is a major deal that they're not talking about. There's no supplements that are given in these facilities unless you put your foot down. So you know what? You've been taking vitamin C, vitamin D, and other supplements your whole life. You go into these facilities and now you cut off. Especially if you're all alone, they're not going to give them to you unless somebody puts their foot down. And there's other issues, like I said, being changed in a timely manner. No patient should have to wait for more than 20 minutes to be changed or cared for. It should be a law. You know what I tell people? If a dog, my little dog is sitting under the desk right now, Sonny, I just got him because my dog's died on top of everything else in the last 2 years. My heart has been broken so many times and I've cried so many tears, I don't think I have any left. If my dog is, or if a dog is neglected, abused, or mistreated, if a dog is left out in this heat at 115 degrees, the owner's going to be fined, arrested, and literally put in prison. But when a human being is being treated, neglected, abused, and mistreated in these facilities, there's barely anything that happens. Oh, I mean, come on. What are we saying? Our dogs are more valuable than our loved ones? Now, I'm a dog person. If you're going to put your dogs out in this heat, good, throw them in prison. I'm all for that. I'm all for strong laws that protect our pets. But there has to be equal laws that protect our loved ones. You can't just let them sit in the bed all night long, not changed.
So is this a situation where the public is simply not aware, or people are aware but they don't care? People must have relatives in these facilities. There must be some level of awareness.
A lot of the times, all right, our health services downgraded, dismissed without any investigation, hundreds and hundreds of very serious complaints of sexual and physical abuse committed against long-term care patients in our state. This was discovered by the Audit General of the state of Arizona, conducted an audit because health services they received $1.6 million about 3 years ago to hire more surveyors. Then COVID hit. Then they didn't hire more surveyors. This triggered an audit by the Audit General of the state of Arizona, and what she uncovered was shocking. I spoke at one of those hearings chaired by Representative Longden. You could see what I said on my website. If you go to my website, on the books, there's options on the top. You click on the books page, go all the way down, you'll see me. You'll see me come out, and you'll see me speak on what I said. And what the Audit General uncovered was hundreds and hundreds and hundreds of patients in these facilities were sexually and physically molested, sexually and physically abused, and these complaints were downgraded, dismissed without any investigation. When I approach our elected officials about this, I get nothing but sidestep. Nobody gives me a straight answer. There's been no accountability from the governor on down, both governors, okay, Ducey and Hobbs, haven't done a thing about this. There's been no public hearings. There's been no calling in these officials to say why these complaints weren't investigated. Now, here's what the interim director said. The interim director said, well, when the patient dies, the family files a complaint. They're upset. They're emotional. And, it's just not accurate. They're being hysterical. Well, here's what I say. Usually, complaints don't come in until the patient goes home or goes to the Lord. Why? Because they're worried about reprisal. Okay. So what happened was these patients died, and then their family members filed a report. When those reports got to our health department, they look at them and go, oh, the patient died. Downgrade, dismiss without any investigation. If you're not going to have an investigation, then there's a high probability that the staff are still working in these facilities that committed those violations. There's been no accountability at all. I've asked our elected officials to contact the United States Justice Department to open an investigation into this, into our health department, of why there's been a systemic breakdown in protections for these people. And I filed a complaint. I haven't heard back from them. All my elected officials won't even give me a straight answer.
So, the thing I'm not clear about is what the root cause is. Is it because these facilities are not properly funded, or because the profit motive is so great that they don't staff to an adequate level so that they can just reduce costs and increase profits? Is it lack of funding? But these are all privately run facilities, or are they government funded? But what's going on?
When you have less staff on Friday, from Friday to Monday, what does that tell you? It tells me they don't want to pay. It tells me they make more profit Friday to Monday. You have the staff, okay? You're not, the RNs are supposed to step up and help the CNAs. They're reluctant to do so. Now, again,
so they have the money.
Not everybody. There's good people in our healthcare system. So let me make that very clear. I'm not calling out everybody in healthcare and saying they're all bad. There are very good, loving people in our healthcare system. But the way the system works, the CNAs do your job, the RNs do their job, and everybody down the line does their own job. Only when there's an emergency, or only when state is in there, does everybody collectively do what needs to be done to make the appearance that they're giving good quality of care. So what is the deal? It is a very complex umbrella with many levels. So yeah, it could be an insurance issue, a staffing issue, a greed issue, an issue of people just they don't give a damn. There's other people that put their loved ones in these facilities. I've had patients' family, because I ask patients, are you married? The patient says yes. I say, well, does your husband or wife come in and visit you? Oh, well, they did at first, but they say the place makes them too depressed. They don't want to come in. You don't want to come in. Your mother changed your diapers. Your father changed your diapers. You need to get in there. It's not about how you feel. It's about making sure that your loved ones are protected, that their medical wishes are being honored, and they're receiving the love and compassion and encouragement they need in order to survive. You can't just say, I don't want to go in. It smells, it's depressing. I don't want to see mom suffer like that. Well, now you have this problem where you have millions of patients that have been abandoned.
So it isn't just a systemic problem; it's an attitude problem with the public.
Well, yeah, it's a problem that it's a problem of, like I said, money, profits, protecting profits over quality of life in these facilities. It's a problem of people not willing. Like, okay, there's my father was national vice president of Unico. That's an Italian organization back east. He started 11 chapters in the state of Connecticut for mental health reform. Unico means unity. Their motto is service above self. Okay, how many people out there are going to place service above self and reaching out and helping others for the glory of God? You need to read the Good Samaritan. In the story of the Good Samaritan, the man was beaten and left for dead. Now, this was on the road to Jericho, a very dangerous, winding road. It's 1,200 feet below sea level from Jerusalem. So as you go down this winding road, it was conducive for ambush. So the way they would ambush people is they have somebody lying off the beaten path, act like they're hurt, and then you go and help the person, and then they rob you. So when the Levite came by, he just kept on going. When the priest came by, he just kept on going. Now, this could be because they were scared of being ambushed, or they took a vow not to go near an unclean person or a dead person. The Good Samaritan came, and what did he do? He placed service above self and reaching out and helping others. He went and helped the man, risking his own life. He went and put oil and wine on his wounds, put him on his donkey, took him to an inn. Not only that, sat with him all night long. How many people sit with the patient all night long? And then paid to have him taken care of, and said, take care of him, and when I come back, I'll pay you whatever I owe you. That's what we're supposed to do as a society. Martin Luther King, he said something. He said, the Good Samaritan, basically, the priest and the Levite said, basically, what will happen to me if I stop to help this man? The Good Samaritan reversed the question. What will happen to this man if I don't stop to help him? What's going to happen to this poor person if I don't stop to help him? That's what we need to be asking as a society. What's going to happen to these poor people? What's going to happen to these people in need if we don't take the time to help and stop them and put service above self in reaching out and helping others for the glory of God? This is what we need. And it goes back to how we were raised. Are we raised to just chase after money and to hell with the other guy? Or are we raised to help others, to have compassion, to be kind and considerate? This is it all, like I said, there's many levels of why this is happening. It's not just one fix, but it starts with love. It starts by reminding people we need to love each other again. We need to apply the love and teachings of Christ to others, and we need to be more vocal with our elected officials.
So do you have like petitions going, or what are you doing to address this?
You know, I'm kind of a comedian too. The thing is that I contact my elected officials alone or with Pastor Ken. It's more effective. You're going in with a mob, they just dig in their heels. It doesn't work. You know, if anybody out there, but then again, if you have a church and it has 2,000-3,000 people and they say, well, who's our state senator? Who are our 2 state representatives? What are they doing to craft good legislation that will greatly improve the safety and quality care in these facilities? What are they doing? And then you look into them. And if they're not doing anything, then call them up, make an appointment, go visit them, go see them. Tell them about mom and dad and their experience in these facilities. Go with real solutions and urge them to write good legislation. Then when the legislation is written, go and testify for it. Go talk to other members of the opposite party that they cross party lines and do this for the better good of our society and our people. We're not involved. We're too busy, you know, and, you know, here's how you do it, Rick. Okay. Watch this. During COVID, we were all locked out. All right. I fought tooth and nail to get back into the facilities where I go. At some point, I got in contact with State Senator Kate McGee, who chaired the Health and Human Services Committee at the time, and I talked to her on the phone for 2 hours. She was unaware of what our function was, and I said, "You need to reclassify us as being, you know, at least one healthy screen family member who takes the same precautions as staff, and members of clergy to get in there and be by these patients' side. Reclassify us as being essential caregivers." All right. Well, she contacted the governor or the Health and Human Services division of our state, either one, and reopened those doors. How do I know that? Because I needed that piece of paper to get into the facility where I was at. I was in constant contact with her office saying, did it pass? Did you do it? Is it open? And when it was open, I said, well, where is it? I got to have that piece of paper. You know what that piece of paper is? Our Constitution, our Bill of Rights. You got to have it in your hand because our constitutional rights and our Bill of Rights, our civil rights are being trampled on, and nobody's got that piece of paper in their hand. So what did I do? As soon as I got that in my hand, I contacted the facility where me and Pastor Ken served. I talked to their executive staff, and I said, we're going to come down and we're going to visit Pastor Sean on Monday. They said, oh, no, we're not having visits yet. And hemmed and hawed about it. And then I called the regional compliance director for the facility, the parent company of where I serve. And they were dragging their feet. At some point I said, look, here's what we're going to do. Me and Pastor Ken are coming down to the facility on Monday morning. We're going to go in to see Pastor Sean. Okay. If you don't let us in, we're going to immediately go and file a complaint with the Health and Human Services, with the long-term care licensing department, at which point a survey is going to come out on site, show that you're out of compliance, and your facility is going to be heavily fined. And within an hour, we worked out a visitation plan. That's how you defend your civil rights. That's how you defend your rights. Because if me and Pastor Ken had shown up and said, hey, we're here to see Pastor Sean, it's it's part of the guidelines now, they wouldn't let us in. You got to put your feet down. And that's how you do it. There's a lot more to this that I could get into, but I don't want to get into right now. But the thing is, what do we do? you have got to put your foot down. You got to know who your elected officials are. You got to hound them on social media and Twitter respectfully, no swearing. And you have to just be respectful, and you got to hound them. You can't treat people like this. My mom was treated horribly. My father was treated horribly. One day I'll tell you their story. And it's on my website, Healthcare, an American Heartache. Read that. In one day, my mother, she went into full respiratory failure because they didn't give her a medication she'd been on for 30 years. Her body went into shock, went to full respiratory failure. My father had prostate cancer. My nephew was born in another hospital across town, premature. His mother had to be put in an induced coma because of complications with child birth. And my nephew, who is now in his 20s and served honorably in the United States Air Force and now serves in the Air National Guard for Arizona, had to be air evac to John C. Lincoln or Children's Hospital, and he would have died in transport. So here's me and my dad in the room with my mother. She's on 12 IVs. We don't know what's happening. They drugged her unconscious. They have a ventilator down her throat, tied to the bed. My dad's weeping bedside. And we got to decide, are we going to stay there with mom or go to the hospital to be with my sister-in-law, or go to the hospital to be my brother and his son? My family was in 3 different hospitals on the same day. Okay. And this started 4 years of living hell for my family. It's a no wonder why I'm a chaplain and a healthcare activist. Anybody gone through half of what I've been through in the last 25 years, you'd be down at the state capitol every day. And so this is who I am and what I do, Rick.
Is there another direction or another area you'd like to explore with this subject tonight?
Yeah, it's called love. Anybody that's watching and listening, show your loved ones the love and compassion they deserve. Now, I know you have family members that may treat you poorly. And I know mom and dad, you may have had a mother or father that didn't, maybe weren't kind to you. I'm sorry. They go in one of these places. It's not revenge time. Be the better person. Be the light of Christ. Go in and hold their hand. Be with them. Okay. Until they breathe their last breath, at least show them that you love them no matter what they did to you, because nobody deserves to be treated like the patients, the things that I see, a patient waiting 6 months for a wheelchair, patients needing basic services, dental care, haircuts, hearing aids, eyeglasses. These are things that could be donated to the activities director. Books. If you have a talent, if you play guitar or a musician or any type of talent, you could go and volunteer in these places and bring a little joy to these people. Whatever it is, or if you're just, you're someone that works at a factory. It doesn't matter if you have a heart. Okay. And you have compassion. You could just go and sit and be somebody's friend. That's what I would hope somebody would do for me when it's my turn, not just leave me and say, well, Dad, you know what? I can't, it's too hard for me to see you suffer like this. I'm sorry, Dad, thanks for the good times, but we'll see you at the funeral. You can't have an attitude like that. It ain't me. It ain't about me. It ain't about you. It ain't about I. It's about him. And it's about the love and compassion that we all need to share with others in order to have a better world to live in, and that's it. I mean, boy, that's good preaching. That's pretty good preaching. Okay.
Is that something you see often, is people who need eyeglasses or hearing aids, but don't have the means to afford them?
You have to look up, how much are hearing aids? How much are eyeglasses? How much is dental? And say, you don't get that, in certain cases with certain insurance or Medicare. You're on your own. Oh, they'll pull your teeth out, but okay, what about eye care? I've donated eyeglasses. You go to the dollar store and buy readers and bring them into the activities director. How much is that? Spend $20. Go buy 20 readers and go in and give them to the activities director so she could give them to the patient that that would like to read the Bible but don't have glasses. A lot of patients that are all alone. They got nobody. Just to go in and sit by a patient's side who's coma, semi-coma, and pray for them. They could still hear you. They need to feel our love. You know, the staff members, God bless them, they don't have the time to sit with a patient for an hour. They come in, they do their job, they chit-chat, and they go to the next patient. You know, the human condition, you got to go in, you got to sit with them. I'll sit with a patient for an hour before I leave, especially if they're going through a very difficult time. You know, by the time I leave, they don't need psych meds and antidepressants. You know, like Pastor Sean, you want to start something, you start this phrase, Jesus loves you and so do I. Start telling people that. If they say, well, you don't even know me, how could you love me? It's an expression of the Lord's love through me. Jesus loves you and so do I. You tell your children at night, Jesus loves you and so do I. Tell your family members, Jesus loves you. Tell your neighbors, Jesus loves you and so do I. Start spreading it around. The whole world's falling apart, and we're searching for the vaccine. We're searching for this. We're searching for that. We're searching for this. The answer is right in front of us. It's called love. That's what we need as human beings, and that's what we're not getting. We don't even talk to each other in the store. We drive past each other on the freeway, and we flip each other off if you're driving too slow or too fast. You know what I tell people? That old lady that's driving too slow on the freeway, next time, maybe her husband just died. Maybe her husband's in ICU. Maybe she just got the bad news that she's got cancer and she's so overwhelmed that she's driving 40 miles an hour down the freeway. Why not pray for that person, have a little compassion? Yeah. Maybe the guy lost his job. Maybe his wife died. Maybe his child was in a head-on collision like some of the patients that I deal with. And maybe he's so stressed out that he's driving, 40 miles an hour down the freeway. So instead of flipping him off and banging on the horn, how about praying for the man or woman? You know, that's what we need in life. That's what's missing. So,
yeah. Would yeah, I mean, that's pretty much the story right there. Are you open to having some people join the conversation and maybe ask you some questions here tonight? Would that be okay?
I would, you know what, Rick, usually people tell me to be quiet and go in the other room. I'd be happy to answer any questions.
Okay, so let's do this. I will put the link to the studio in the chat. So there we go. It's going out now. There's a typo there. Copy that. I'm going to put it over here in Rumble as well. So for all you folks watching on Rumble tonight, just give me one moment and I will have that and that over there for you too. Here we go. All right. We're in there and I'll put this on Rumble channel 2 as well. There we go. So if you just click that link, folks, that I put in the chat, it'll take you right into the studio. I will see you in there. And unless I see some really, scary people, I'll click and let you in to join the conversation. So also I'll put a banner up here on the screen. You'd have to type this out, but if you're watching and you're not in the chat, then that's the URL right there. Oops. If you type that into your browser, that'll take you into the studio. So let's take a brief break. We already have a couple of people in the back room, and we'll bring them into the conversation in just a moment. Hang in there. We'll be right back.
Maverick News. The world is watching.
We're back, and first up, here's Gina. Hi there, Gina.
Hi.
Hello.
Nice to meet you, Chaplain. I actually worked in the facility, in and out of facilities for 18 years in British Columbia. And everything that you're saying is the same thing that happens here. One of the reasons why I had to get out of where I was working was because I couldn't handle the amount of abuse that was going on with our clients. I would be called in and I would be called, oh, well, Gina can go in and rescue. And I would go in, I'd fix everything and then, get everything set up, get the client right, get everything going the way that they're supposed to be going. And then they would slowly start bringing other people in. And then I would be phased out and brought to somebody else's place that needed to be fixed. I did home care for the most part, but I did do a lot of time in facilities, worked in dementia ward. And boy, oh boy, I tell you, in the dementia ward, we got 4 toilets in the toilet room. No dividers between the walls. We would come in, bring these seniors in, drop their pants everybody's got dementia. Nobody knows what what's going on, but there's absolutely no dignity, even if, they are aware or aren't aware. This is what's going on in British Columbia, people. It's disgusting. Like absolutely disgusting. And I don't know how many times, I worked really, really hard with my supervisors to try to change things, to try to make a difference where I could. Like I said, I was always brought in to rescue people because, it just seemed that there didn't seem to be enough people or enough decent staff that, oh, well, you want to talk about decent staff that can actually understand the clients? Oh, well, they might have 5,000 staff, but ask how many of them can actually speak English or know how to cook English food. They don't even know if they know how to cook an egg, they say they don't.
So do you have a question for Chaplain Paul, Gina?
Basically, what I got here is I just wanted to put some support out there for Chaplain and let him know that the same thing's happening in Canada. And I don't know what, I never thought to, do any kind of a sort of, like a petition or whatever, because trying to get people, because like you said, trying to get people to actually do anything, like it seems unless you're doing the one-on-one thing, there doesn't seem to be anything that we can do. I have tried different ways, but I working with finding a caring supervisor that actually is willing to help, and then whether or not they're capable.
Oh, we lost your feed there, Gina.
Not the clients. I really don't. Besides, trying to get people, like you said, trying to get people in there to volunteer, to step up, thinking that, oh, it's okay for my mom. My mom is okay in there because she's being taken care of. That's not the case. There's not enough staff to even half the time feed them. There's never because you got a minimal amount of staff and you've got 4 people or 6 people in a room. How do you feed 6 people? We're expected to. So meals only come for so long. They can only, be, so by the time you get to the next, or you're running between that person swallowing and going to the next person to get them to swallow. But if they're a choke hazard, then you're supposed to be watching them, but you can't really watch them if you got to go feed somebody else over in the other bed over there. And it's unbelievable how bad it is in British Columbia. And it doesn't seem to matter what we do. It sounds like you got the same frustrations there. So I would like to see, you're in it now. You are in the middle and you are in the thick of it now. And I'm really glad to see that you're speaking out. I'm glad that you're here and you're going to make some sort of a difference, at least if nothing else, more awareness. But honestly, I would like to connect with you personally, independently, off show, and maybe talk about things that I might be able to suggest that maybe we could come up with for some brainstorming. But yeah, I don't know. It's just awful. And I see.
Well, do you have any comments on that, Chaplain Paul?
Well, here's the thing. Like in your own case, okay, because you worked in the industry, right? Well, I thank you and commend you for going the extra mile for the patients. Okay, that's really good. You see, you're one of the good people.
Yeah.
Okay, so you're a hero. I mean, in my
Thank you.
eyes. Okay, and so the thing is, and more people should be like you, right? To go the
I
extra mile and
agree.
have that concern for the patients. Okay, so and like I said again, there are a lot of many people in healthcare are loving, caring, compassionate. I'm not saying, but if you're overworked and you don't have enough people, you don't have enough staff, there's so much you could do. So one of the solutions again is individually. Individually, you contact the activities director of a place that's near you, and you go in and volunteer a couple of days a week. When the problem is when you look at a problem and you say, "Well, I can't change the world. I can't change." No, but you could help one person.
That's right.
You have a dog, right?
Yeah.
The dog there, right? You
Yeah.
have a dog. Okay, I have a little dog that I got from a shelter. I can't save 250 dogs that are in the shelter. I saved the one.
That's
Okay.
right.
There's a story here. Let me get something real quick. You see this? This is a sand dollar. Okay. It's given to me by a patient because I told this story. There's a guy on the beach. He's picking up sand dollars and throwing them in the water. There's another guy walks up and says, "What are you doing?" He says, "I'm saving the sand dollar." He says, "You can't save all of them. There's thousands of them." "No, but I could save this one."
That's
So
right.
don't think to save the world. Just think, go be a friend to one person. Just
Bingo.
one. That's all I'm asking. That's, just go and you contact the activities director of any of these facilities. "Hey, I'd like to volunteer." They'll screen you. You get a TB shot, whatever. And you go in. When do you go in? You go in whenever you want. You just abide by their rules. Okay.
Yes.
You can go and visit the person whenever you want. Okay. So you got one, maybe you got three, 3 or 4. Okay. But you just start with one.
Yeah.
And go in and visit the person and treat that person like a family member.
Yes.
Make sure they're being eaten, but you're getting proper food, making sure that you become their friend, making sure if they need a CNA, you go and get one. Otherwise, they're going to wait an hour. They need an RT, you go get one. You need the doctor, you go get them. You need the social. I had a patient. Okay, I went in on a Thursday. "Oh, how's it going?" "Great. I'm going to see the social worker today." "Oh, good. I go back on a Tuesday, still hasn't seen the social worker."
Mm-hmm.
Well, you know who went and got the social worker? Chaplain Paul went and got the social worker.
Yeah.
If you're not there, who is going to go get these people? So if you could help it. And another thing, when you're on site, how many times I walk by a patient's room and they're flipped over in their wheelchair, or they fell out of the bed, or they're throwing up. They're coma and they're literally throwing up, which they can die. And I go and get somebody. Just being on site, you're a blessing. Just being a positive influence in that facility, offering prayer to the staff, offering prayer to the family members, being a listening ear, a compassionate heart, and a helping hand. Just do it for one person. But while you're in there, you're the light. You're a light of hope while you're in these facilities. Yeah. So don't ever think one person can't change the world. You can. You could change the world of somebody that's all alone.
Yes. And what about doing their nails? Like, I mean, that's one of the biggest things, like, especially with the elderly ladies, if women in here or whatever that want to, go in and do their nails or brushing their hair or styling it, even just curling it and styling it. Those are things those women just don't get at all. And if they were women who loved getting their nails done and who loved getting their hair done, that little bit of attention goes a long ways. Like
bringing in
listen, Gina, I've got other people in the queue, so we're gonna move along. Thank you.
All right.
For joining us tonight. Okay, let's go on to Heidi. Hello. Are you there, Heidi? You look like a ceiling.
Oh,
there you are.
Yes, I'm here. Thank you. Thank you so much, Rick and Paul, for this podcast. I can't even tell you how much I understand it and appreciate it. I did work in a nursing home for 3 years, and I work at a funeral home now. So almost everything Paul has said, I've experienced, but not to the extreme degree that he has. And so when I just want to say, Paul, that I always went behind the scenes to bring patients small things they needed, like toothpaste, an extension cord. They didn't have family who came to visit them, even if they were wealthy or poor. And so I would, maybe play a little music for them. And there are times I had to lift them if they fell off the sofa. And then I did a few diabetic tests back when you still had to poke the needle in the arm. And my question is, do you believe in natural medicines, and should family or friends be able to bring that to patients if the medications are too rough for them?
In the United States, most nursing homes, care center, medical rehabs don't allow like medical marijuana, Asian methods of healing. They don't allow holistic healing, that type. Okay. Now, as a matter of fact, like I was saying earlier, that many of these places don't provide supplements. So, I mean, you're taking vitamin C and D and all this other stuff, and then you go in a facility and, you got to put your foot down. You got to say, no, I want mom to continue to get her vitamin, provided it doesn't interfere with the medication, obviously, right? You want to make sure that it's not going to, but, spirulina, things like that. There's all of these other things that help to give you a positive mental health and help for your body, and so unless you put your foot down and demand these things, it's not provided, In the United States, like I said, medical marijuana is legal in Arizona. Why not allow the patients to have that option? There's a lot of medications where patients, they lose their appetite, or like with chemo, you're throwing up, it affects you that way. Well, thank God it's legal, but if you're in one of these facilities, you're not going to have that option. So, it's being vocal. Hey, look, people that work in these facilities, they don't want to risk losing their job. Okay, here's the deal. To all the people that work in these facilities, volunteer one day, volunteer a couple of 3 hours a week, volunteer in the facility where you work, volunteer to go in for 3 hours and sit with a patient or two patients, on your off time. If the facility doesn't let you, then sign up with the activities director, and say, look, I want to be part of activities. I want to volunteer on my days off for 3 hours. It takes that. It takes having the willingness to be by these people's side and making sure they're being cared for. When COVID hit, the argument was, oh, well, we're going to put these people in isolation to save their life. You didn't save their life. It was detrimental on their physical health, their spiritual health, their mental health. It was devastating for their physical, mental, and spiritual health to be isolated. I had patients isolated for over a year without any visits, stuck in their room for a year. I was telling my wife, when I'm sick or I'm in pain and I reach over to hold her hand, that's comforting to me. How do you feel if you're in one of these facilities, you're sick and in pain, you got nobody's hand to hold? Okay. It's not right. So, be a hand holder. All right. Let's start hand holder, worldwide hand holders. Go hold somebody's hand. These are the things. You don't have to, like I said, it's not something where you got to save the world. It's you pick a little piece here, a little piece there, and you go and volunteer. You let your voice be heard. You tell your story of what your experience were working in these facilities, and encourage others in these facilities to go the extra mile and contact your elected officials and say, we cannot continue to allow people to be treated like zoo animals and prison inmates. Death row inmates during COVID, the lockdowns, death row inmates are treated better than the patients I visited. The patients I visited were in the room 24/7 without any visits by clergy or family for over a year. Death row inmates at least get out for fresh air and sunshine. So, I mean, what are we doing? It's just it's just not right. So, I thank you. You seem like a good-hearted person. You went the extra mile. You're helping people. And so, Chaplain Paul, again, I applaud you and I appreciate you. And I hope that you will just seek to go out and be somebody's friend. One person. That's all. Look, here's the deal. Okay. Just save one sand dollar. That's it. One sand. What does this represent? One person that's laying all alone in that bed wondering where everybody is. This person getting fed, pig slop. I mean, if you go in and you adopt one of these people, you could bring them food as long as they're not diabetic and it's, part of their diet. You could order them healthy foods. You could bring them the love and compassion they desperately need. You can make them homemade chicken noodle soup and bring it into them. I guarantee their health will improve. If nothing else, they'll be more happy. They'll be more at peace. And it'll be a better world. Just save one person. That's all. Go help one person. That's all you got to do. That's
Yes.
all, that's basically it. It's not, this isn't hard. It's very
Right.
simple,
Yeah.
I'll just get you to wrap up here, Heidi, so we can move on to our next person.
Bye-bye,
Oh,
Heidi.
okay. Yes. Thank you so much. Yeah, and when I worked in the nursing home, I would go in there every day thinking, I need to create miracles in this place where they aren't allowing space for miracles. And so, like you said, just the smallest things. I played music for this lady one night and she couldn't respond, but I felt like the music was calming to her. And just even small things like clipping their nails, like I totally understand. So thank you so much, Paul and Rick.
Be the blessing
Thank you,
and the
Heidi.
miracle in someone who's suffering. It's that simple.
Okay,
Yes.
we're gonna move on, and I know this person here. Are you there, Lori?
Hey, Rick, can you hear me?
Spock's brain returns.
It is me. I apologize. I'm actually going to an event tonight and I'm sitting here with curlers in my hair and I look stupid. So that's why I'm audio only today, gentlemen. Sorry about that.
No problem.
You wouldn't want to see me with big old rollers in my hair. But good evening, Chaplain Paul. It's a pleasure to finally get to speak with you. We've interacted on Twitter quite a bit, and it's wonderful to finally hear you talk. This conversation hits me in my feelings. I've been there. I've been down that road. I just want to give you a quick version of a long story. I lived in Austin, Texas. My mom was up here in Oklahoma. She became ill in her 70s and was no longer able to live independently. She was a widow and got to that point, where she just couldn't take care of herself anymore. So I did the thing that only children do when you don't have siblings to help out. I packed up everything, moved up to Oklahoma, moved her out of her apartment, got a bigger house, moved her in with me, and took care of her until the end of her days. But due to the nature of her illness, she was often in and out of hospitals, had to have several surgeries. And of course, they kind of force you to go into a nursing home for 30 days for post-op care, skilled nursing care. I didn't want her in there, but it was required. So she had to go. And boy, I tell you what, I saw the level of so-called care at a lot of these nursing homes, particularly the Medicaid-funded nursing homes. You know what I'm talking about. And so I took it upon myself to be there and basically be her night nurse from 10 p.m. until 6 a.m. I would stay up all night, stay in her room, just stay with her. And I'm glad I did, because there were several occasions where there were medication mistakes, where they had over-medicated her with sedatives, and she had COPD. So of course her lungs started to shut down and she would have died. I don't think a nurse would have made it there in time. There were many occasions that I think I probably saved her life. So I'm glad I was there. And I just wanted to address a couple of things. It was great to hear from Heidi and Gina some of the good people who have worked in these facilities and gone above and beyond the call of duty. I met nurses and CNAs like that, and I just want to thank each and every one of them for all of the things they did for my mom and the things they do for others. It's important that they have good food, because you're right. Most of these facilities serve absolute pig slop as food. It's all processed food. It's from a box or a can. All the nutrients are gone. I love to cook, so I made a point to cook dinner at home every night for she and I would bring it up to the nursing home or hospital, and we would eat together. I brought her good, nutritious meals. I brought her vitamins, and I had to argue a lot with the nursing home staff or the hospital staff. They would not allow her to have herbal supplements and vitamins unless they had thoroughly checked them out, which was fine. But perhaps the worst thing was they would not allow her to have cannabis. And she had an inflammatory disease. Cannabis was very helpful to her with pain management, with inflammation, and just with generally keeping her in a good mood, good spirits. They were trying to medicate her with, prescription drugs, many that she really didn't even need. She preferred the cannabis, but she couldn't have it in these facilities because of the federal law. So I would have to make, marijuana brownies and sneak them in, slip them to her when nobody was looking, and it helped her a great deal. So that's something we need to change. And I would like to work with you on that. As you know, I'm a volunteer recruiter for the RFK Jr. campaign. I know that you're paying close attention to Kennedy as well. And one of the things he's advocating for is the decriminalization of marijuana at the federal level, so that would finally solve this problem of doctors being able to prescribe cannabis therapy in hospitals and nursing homes. And I hope that I don't know your personal politics, sir, I don't know if you plan to vote for Kennedy, but I hope that we can agree on that one issue, if nothing else, and that you will work with us as a volunteer and lend your expertise and your passion to our campaign for Kennedy. One other thing I wanted to say, Gina, I think, brought it up, and you did too, about music, the power of music to heal and to make people happy in these facilities. I'm a musician, spent most of my life in the music business, and I would bring my guitar and come up and sing and play for Mom at the nursing home. Next thing you know, I had a big audience because people from adjoining rooms would come over, and, next thing you know, it's a concert. And it's a beautiful thing, those are some of my favorite memories of her final years, and it made her feel great. She herself had been a singer and songwriter, and because of her illness, she couldn't sing anymore. But I saw my mom sing for the first time in 10 years when I sang some of her favorite country and Western songs for her at the nursing home, and it was a beautiful experience. And something else that people can do, like Gina said, it makes a huge difference if you want to volunteer to just go do someone's hair. Say you're good at doing hair or makeup, or put curlers in your mom's hair. And it made such a difference for my mom's mental health point of view, general demeanor, just to feel good about herself. And I just want to say one thing out there to all of the adult children who someday will have to deal with this. It becomes our time with our parents, all of us, sooner or later. Best advice I could give you when it's your turn is to keep a watchful eye on the staff, watch out for medication mistakes, be there as much as you possibly can. Sit there on the night shift, come sleep at the nursing home if you can get a bed or a comfy chair, sleep beside their bed, stay with them, because these places are understaffed and mistakes do happen. The best thing you can do is be there and try to bring them some good food from home. That's all.
All right. Thank you, Lori.
That was
My
awesome.
pleasure.
Can I respond
Thank
to
you.
that?
Please do.
I'm a huge supporter of Robert F. Kennedy Jr. For a lot of reasons. One issue that is not being discussed is that a lot of these patients who have no family, they were forced vaccinated with the
Yes.
COVID vaccine against their will. That was a
Yes.
major civil rights violation.
Well,
When you have, I want everybody to understand that the only civil rights we have are those that we're willing to stand up and defend. Because if somebody violates your civil rights, they're not going to come swooping down in a helicopter at your defense. You're the one that has to be educated. You're the one that has to know how to defend your civil rights, exercise your civil rights when people are taking advantage of our civil rights. Millions of long-term care patients died all alone in isolation during the lockdowns. Their civil right
breaks
to
my
have
heart.
visits by at least one healthy screen family member and by clergy were flatly denied. I lost patients I loved that died all alone in isolation. Patients I loved, like Greg, the humble sea turtle. Okay. He died all alone in isolation. I love this man. I couldn't get in there to be by his side, and many others died that I loved. Okay. So what's the deal? I'm going to be blunt about this. Any elected official who did not speak out, who remained silent, and did not step up and defend our civil rights during the lockdowns broke their oath of office and must resign. We cannot continue to elect people that are not going to defend our civil rights. We can't do that, especially for when people in these facilities, their civil rights, their human rights, their patient rights are being violated, and there's nobody to defend them. You can't allow it. There's two bills. One of them that I testified, House Bill 2575 by Representative Wynn. He's my friend. He crafted a bill. His friend died in the hospital all alone, and he couldn't get in there. He couldn't have his member of clergy by his side. So he crafted House Bill 2575. I spoke remotely. I testified in favor of that bill, and it's passed. It was signed by the governor. Then he crafted another bill that says all patients in Arizona are allowed at least one healthy screen family member during a pandemic, statewide, or national emergency. That's signed by the governor. So
That's
this
a great
will happen
law.
again. Okay.
Great law.
So, but there's a long way to go. Again, our civil rights matter. Okay. Our freedoms and our rights matter. Robert F. Kennedy Jr. is the only one stepping up and saying, look, those lockdowns violated multiple civil rights violations. Constitutional rights were violated. Churches were shut down without due process, but the strip club and the department stores were left open, but the churches were shut down. That's a major civil rights violation. There has to be due process of law to show that a church needs to be shut down over a department store, okay, because of health reasons. That was a major violation of our civil rights. Nobody did anything. Very few churches had the courage to step up and fight that. You had situations where, like I said, patients were denied visits by clergy. That was a civil rights violation. Patients denied at least one healthy screen family member that takes same precautions of staff. That was a civil rights violation. And on and on and on we go. Businesses shut down. My friends own an Italian restaurant out here. The owner had to still pay $12,000 a month during the lockdowns. Just because there's a lockdown doesn't mean the landlord doesn't get paid. He had to pay $12,000 a month while his restaurant was shut down. It's a civil right that if the government is going to have a lockdown, that these businesses be compensated. It's our civil right. Well, who's stepping up? Who's saying, hey, you broke my civil rights. My restaurant was shut down. I had to pay $12,000 a month for rent, and yet I haven't been compensated. See, we don't know what our civil rights are. We don't know what our constitutional rights are. We don't know how to defend them. We don't know how to exercise them. We don't even know how to teach them. We don't even know what to do. So when they're telling us, oh, you got to stay in your house and do what we tell you, no, we need to start teaching our children to question authority. We've taught a generation of kids in this country to be respectful and do what you're told. Don't get in trouble. If the police officer says you should do something, or if the government says you should do something, or if your teacher says you should do something, you should do it without question. No, we need to raise up activists that say, well, wait a minute. This my rights here in the Bill of Rights say otherwise. We're afraid to ask questions. We're afraid to fight back. We're afraid to step up and defend our rights. That's why I support Robert F. Kennedy Jr. I'm an old school Democrat like he is. My father was high up in the Democratic Party back east. We're all dying off. It's us that are going to put things straight. So I support him. I have a heart like Kennedy, just like he does. So that I support him 100%.
Oh, that's wonderful. Yeah, I'm an old Kennedy Democrat too. And Kennedy's bringing me back to the Democratic Party. I've been a libertarian for the past 30 years, left the Democratic Party in the 90s because I thought the Clintons ruined it. But I'm coming back, and I'm only doing it for one reason, and that's Bobby Kennedy. And for all the reasons that you just talked about, and a whole lot more. And, Bobby's the only presidential candidate who's really been vocal. I mean, DeSantis has to some degree. I guess Ramaswamy has, but he has, been consistent throughout the entire pandemic, starting from the lockdowns back in 2020. And on this particular issue, this really hits home for anybody who lost a loved one in the hospital or the nursing home during COVID, whether they died of COVID or not. They were not allowed to come in and say goodbye to their parent or their spouse or their child or their loved one. And it's heartbreaking. Chaplain, I'm so glad that my mother passed away before the pandemic, because she would have died in a nursing home alone during the pandemic. And nothing breaks my heart more than the thought of having to say goodbye to my mom over FaceTime or through a window with me sitting outdoors and I can't touch her or hug her or hold her hand. So Bobby Kennedy is going to fix this. He's going to make damn sure that that will never happen again. It was the greatest tragedy, the whole pandemic, if you ask me. And so many of our deaths were in nursing homes and long-term care facilities that were probably unnecessary deaths, like the situation in New York with Governor Cuomo, putting COVID-infected patients in a nursing home where the virus then spread quickly through the whole population and killed those vulnerable seniors. He resigned, but not because of that. Remember, he resigned over a sex scandal. He should have been forced to resign for that alone. So I'm glad you're with us on the campaign, and I host regular Twitter spaces about Kennedy for the campaign, and I would love to invite you on my next one so that we can talk more in depth about these issues that matter so much to us both.
Well, we'll see we'll see what God has in store. About the Como thing, I'm from Connecticut. My family lives up in upstate New York. Okay. What he did was wrong. Now, here's how God works. Okay. The way that worked, real quick, I'll be about this. President Trump had the resources for those patients. He had the ships and the warehouses, but Como, because of party loyalty and pride, didn't want to do anything to make Trump look good. So he had infected patients sent back to the nursing homes. Thousands of them died. Thousands and thousands of them. So what did God do? You don't get away with this. Vengeance is mine, saith the Lord. So he didn't go down because of that. He went down because of a sex scandal. One way or another, you're going down. If you turn your back on humanity, one way or another, you're going down. God does not honor this type of behavior. Our elected officials, if you're going to treat human beings like animals, there's a price to pay. And again, for Robert F. Kennedy Jr., who was in charge of the lockdowns? Don't vote for him. Okay,
that's right.
Who established the lockdowns without calling in a committee and saying, look, here's the deal. We could suspend, we can limit our rights and freedoms during a national, statewide, or pandemic emergency. They can be limited for a specific time. In other words, okay, we have this pandemic. We're going to put the patients in isolation for 2 weeks. We're going to get experts in here. We're going to create a safe pathway to visitation where at least one healthy screen family member who takes the same precautions as staff could go in on an appointment basis, maybe 2 or 3 times a week, and clergy can get in there because you can't just cut these people off. They have a civil right to have somebody by their side to make sure their medical wishes are being honored, making sure they're being cared for properly, making sure they're getting the love and compassion and kindness they need. Now, here's what I'm going to ask everybody. Who was in control? Who was in charge that made that policy without making sure that these people were protected? Don't vote for them. Okay. Robert F. Kennedy Jr., he's helped millions of people around the world. He's helped to improve the lives of millions of people around the world. He started Riverkeeper, which has 350 chapters, goes in and cleans up waterways, making them safe for humans and for animals and wildlife. He has started Children's Health Defense, which gives real information how to protect our kids from harmful products and medicines. He's already improved the lives of millions of people around the world. He's like no other politician. Most politicians get in and say, I'm going to improve the lives of millions around the world. He's already done it. These other guys, what did they do during the lockdowns? Did you hear anything from our elected officials coming out forward and saying we can't do these to these people? Let's get congressional hearings. Let's figure out a way where these people can be protected and their families could get in there. No, they didn't do that at all. They didn't do it.
And, Bobby fights outside the system. He's never held elected office. He's never run for any elected office until now. He's spent his whole life fighting for people in the courts where it really counts, by suing polluters, by suing Big Pharma on the behalf of the little guy who got injured or killed by their products or their pollution. I would argue he's been more effective than most politicians working outside the system most of his life. It's only now that he's seeking elected office because I think that our country is at that point where it's going to take a strong president who's not afraid to use the power of the presidency to sway Congress or even to just do it by executive order where you have to, but to make some serious changes and reverse this course that our country's on that's leading us to disaster.
He's won over 500 cases. He's a trial lawyer that took on Big Pharma, the federal government, and corrupt polluters and corporate America. He's won over 500. I'd like to get him down here. I'd like to get him down here and take our health department to court and take these politicians to court for not doing their job. I'd like to get Mr. Kennedy down here and file a lawsuit. That would be fantastic. But I'm gonna give it back to Rick, because Rick, I got one thing to say to you. Jesus loves you, and so do I.
Well, thank you. And Lori, we're going to move on to Leo.
Okay, well, I love you too, Rick. Thanks for having me on.
It's a love fest tonight. All right. Thanks, Lori. Talk to you
care.
soon. Bye.
Thank you, Chaplain. Good night.
Bye-bye.
And here he is. Hello.
Howdy, guys.
Hey, Leo.
Yes.
Why do you have that round circular thing on your? Do you have your phone cover on? Is that
I got a phone cover on. I don't know what's going on with this phone, but yeah, it looks like a peephole, right?
Yeah, kind of. Well, anyway,
it is what it is. I can't. I think I'm just going to buy a new phone.
I think it's just the cover is covering up part of your lens, maybe. But we can see you, and you're smiling, so we're good.
So, Paul, thank you for coming on. Lori, thank you. Jenna, thank you. Rick, this is a great show. I knew it when this guy called in. He was a diamond in the rough, but there's no rough about you, right? As soon as I heard you speak, and I went, man, this guy's, he knows what he's talking about. He's educated, and he knows what he's talking about. But yeah, my take on it all on the old age homes, what we call them here. Okay, they're like concentration camps in World War II. Now, the government, it's all about money. They just want to knock people off because over here we have social insurance, we got the CPP, the Canada Pension Plan. Over there, you guys got Social Security, right? So knock them off, save the money, right? I would never, ever, ever send any of my family, immediate family, period, to one of these facilities. Now, my father was dying, got diagnosed with cancer, and I asked the doctor, how much time does he got? And he said, well, I don't know. I said, listen, you do this shit for a living. Okay. I'm a machinist. I know how long it takes me to cut something. What do you expect? He said, no more than 10 weeks. So I went to work where I was working at the time, and I said, I need 10 weeks off because I'm going to spend the night shift from 8 p.m. to 8 in the morning with my father. Okay. So if he gets up in the middle of the night, I could help him move the bathroom, do whatever, right? Feed him, this and that, right? And my work said, no, you can't have the time off. I said, well, it looks like I quit. So I quit my job. Okay. And I did that. And I took care of my father. And at the same, I got a big family, right? But somebody would come in and take over at 8 in the morning, and I'd go home to my family, right? I have no regrets. Now, I got a big family. Some of them went on vacation to Cuba and everything else. And when my dad passed, they have regrets because they weren't there. I was there for my father right till the end. And the same thing with my father-in-law. Now, my father wanted to die at home in the living room, and that's where he died. Okay. And my father-in-law wanted to go to hospice. Okay. So we took him to hospice, and I'm not going to knock hospice. I don't even know what hospice means, Rick. Okay. But if you're in hospice, there's a lot of private funding that goes into hospice, and they have a lot of charities. Okay. Hospice is actually pretty good because there's no time limit. You could go there. Okay. Hospice is you're at the end of the road if you're going to hospice. Okay. And you can spend all 24 hours a day in the room with your loved one.
Yeah.
Right. And I did that with my father-in-law also. Right. So you could keep an eye on everything that's going on. Right. But hospice, and when it comes down to cancer, it all comes down to sedation at the end. Right. Where they try and make you feel comfortable. I don't know about that, because you take water away from somebody for 3 or 4 days before he dies. That don't sound like comfort to me. Right. You're feeding them ice cubes and everything else. But I have zero regrets. Yeah, it was tough when they passed, but I have no regrets, I'll tell you. And it's funny that we're talking about this, because my nephew, he's 18 years old, and his first job's working at an old age home. And what he does is prepares meals and he serves them at the old age home. It's for 4 hours a day, every day. Right. And he worked a double. And he's living with me right now with my son in the basement till his mom gets her house in order. Right. And I really like this kid. Right. And that's what he does. Right. And he likes it. He likes the job. He's serving people. Right. And that's where I get it from, is compassion's my middle name. When it comes down to it, compassion is what I'm all about. And I don't care if it's a bird flying into your window or a dog in distress. Okay. Compassion is my middle name. And if it's to feed the hunger, feed the hunger. You should be a saint, not a chaplain.
Oh no, I'm no saint. Well, you know what? That when you give your life to Christ, you become a saint. Okay, but the thing is that we are the saints. But you did the right thing. How old are you?
I'm 53 now.
All right, so I'm 60. We're like the same. See, we're like the same. We're from the same sort of generation.
Right.
We don't turn our back on our parents. We do whatever we can to help our family. If you have your neighbor, your neighbor across the street, he could even be a jerk, but we go and help him if he's laying on the ground, or if he gets hurt, or if his car's falling on him. I mean, for God's sake,
It's funny you say that, Paul, because the neighbor behind me, he's about 93 years old, and he worked his whole life at Ford's. A really nice guy. He's never been married, no kids. He's been in the house right behind me. I've been in this house for 25 years, and he's been there longer than me, right? And he's always had a garden, but now he's getting too old and frail to get out to the garden, this and that. So I did a garden this year, right? And I bring him vegetables, right, out of my garden, right? Just what I do, right? So, people that turn their back on others, and I get it. There's a lot of people out there, like you said, you may not like your parents because the way that they treated you, this and that, but you got to show some compassion at the end of the day. If you don't have any compassion, don't expect any compassion to come your way, right? You're going to die alone. If my kids, I treat them like gold. Now, it's my choice if I want to die at home or in hospice or wherever, right? If I want to take a walk in the bush way, way up north, cover myself in honey and let the polar bears eat me. That's my prerogative, right? Stand by, right? So, yeah, I commend you on everything that you're doing, man. And I just knew it when you called in. I said, Rick, you can't let this guy walk, man. You got to get this guy on the show. He knows what he's talking about. Now, you've done work with prisons, right, Paul?
With prisons?
Yeah.
I was an inmate. I was an inmate at Kingman State Prison from 2008 to 2010 on a drug charge. You guys were talking about medical marijuana. Well, I'm a freedom fighter. I was fighting that game way back when it was illegal.
Yeah.
But anyway,
me too. Not bragging about anything, and I'm not, I'm not really concerned about where I've been. It's where I'm going, and I know where I'm going. Right. Spent many moons in various luxurious cages throughout Canada for cannabis, right, and other things. But with the cannabis thing, you're not going to find a bigger advocate in southwestern Ontario than me, right? When it comes down to it, and
Well,
I always fight for especially the medical rights of anybody. Okay, when it comes down to cannabis, I know a lot about it, and I know what it could do for others. I know what it's done for me. It may not be for you. It may be for somebody else at the end of the road, right? And a lot of people. Oh, we got somebody else on here.
Yeah, Alicia's just joined us. Hello, Alicia. Can you hear us, Alicia? This is the mothership to Alicia. Over.
You got to hit your audio, Alicia.
Yeah, she's. Hello, Alicia. Hello.
Is that Alicia Valley?
I don't know Alicia's last name. Hello. She's just keep going there, Leo. Maybe she'll get her audio issue worked out.
Yeah. So, I commend what you're doing, and I really respect your honesty, Paul, especially by coming on here and being honest. Yeah, you've been to jail for cannabis-related issues, and it's pretty tough in the U.S. prison system, a lot tougher than it is over here. I know people that have been on that side of the border and on this side of the border, and it's a big difference, right? The way that you're treated and everything else. And in your country, they like to give away many years. We're talking years. Some people, there was one guy here in Michigan right across from me here. He spent almost 40 years in prison on a pot-related conviction, right? So thank God that we're not that tyrant, right? And everything's breaking loose now on the medical aspect of it, right? So, I believe that a lot of people can help a lot of people. It's a lot safer than big pharma, by far. It's not even comparable. Okay, it's an all-natural herb that's been around for many moons, right? So, with a lot of healing properties.
It's an anti-inflammatory, it's an anti-inflammatory. Okay, a lot of the pain meds are it deadens the pain by going up to the receptor, I believe, in the brain. Okay, the medical marijuana actually is a pain reliever and an anti-inflammatory. Okay. Right. You don't have to get stoned. You don't have to sit there with a bong. I mean, you have like a grain of rice, or they have other methods of ingesting. They have salves, tropical salves that you put on your skin. The deal is that I've had friends that their family members had cancer, and the chemo was preventing them from eating. They couldn't eat. So you give them some pot, and it creates. It's one of the few things where they can get an appetite to eat. And the old school mentality. Look, pot isn't for everybody. It's not for me. When I smoked pot very rarely back in the day, it created more of an acid effect in my life. I could tell you stories of climbing a tree and all kinds of stuff. But the deal is that for me, smoking it, but for the sake of freedom. Okay, for helping people that are in pain, let's get real. Alcohol, right, I would think, is more dangerous than pot. I mean, come on, man. You know what I'm saying? You smoke pot, most people just want to sit around and watch TV and eat. You drink, you want to go out and raise hell. I mean, it's ridiculous. So anyway, we know all the history. We know why it was suppressed. Where are we going to go from here? Well, we go from here is like what I said. It just begins with dialogue, talking about it, finding it within each of ourselves to reach out and help people around us. It's not rocket science. What you did for your dad, dude, you got my thumbs up, man. You're a good guy. I appreciate you. You did what you had to do for your father. That's a good thing. People should, tell your story. Tell people what you did, how you did it, what you did for your pops, what you did for your dad, and tell your children and tell people around you to instill that quality that should be in all of us, instead of this running after money at your neighbor's expense. Oh, I gotta have the money. I gotta have the money. Well, what about the neighbor? Oh, no, screw him. Let me tell you a quick, here's a comparison. There's a cruise ship. Okay. It's low. It's got Democrats and Republicans on it. Okay, I'll just use that as a thing. Okay, the cruise ship is going along, and the captain's walking the deck. The captain's walking the deck. A big wind comes along, and he's blown off the ship. Now he's in the water. Everybody runs over and looks over. Who's going to get him? I'm not going to risk my life. I'm not jumping in the water. I'm not going. Nobody helped him. He drowned. Now they don't have a captain. Now the boat sank. That's basically what our world is right now. We're letting people fall off that boat that we need, and we're just letting them drown. Nobody wants to jump in the water and risk their own life to help anybody.
It's funny you talk like that because the other night, I watched the Titanic again for the 20th time. It's a 3-hour movie or whatever, right? But me and the wife are sitting back, and I'm going, and they got down to the stats at the end. There was 1,500 people that perished. Okay, there was 700 that survived on lifeboats. Some of the lifeboats, okay, had 20 people on them that could have held 50 people. Okay, the rich were on the lifeboats. Obviously, they were making the payoffs, and they had to live with that. I go to my wife. Imagine living with that. You had room on the boat. You could have went over capacity. I would have went over capacity. Okay. But no, it was all for themselves, right? And they had to live with that for the rest of their lives. And the one guy, he was a steel tycoon or whatever, right? And in the crash of 1920, he ended up taking a gun and putting it in his mouth and blowing his head off. And it's all in that story, the Titanic, right? But it reminds me, your healthcare reminds me of the Obamacare, okay, with the addictions, okay, people trying to come off of heroin and fentanyl and everything else, okay, he guaranteed a place, especially in California, he guaranteed a place in recovery for everybody. Now, these guys were going out and getting people to get into the recovery houses, okay, getting the money, then kicking them out on the street and giving them drugs, okay, so the process just kept going round and around and around in circles, and there was like headhunting. Okay, one guy had 150 clients, and it was $20,000 every time he would bring them in. The caregiver of these addiction joints would give them the cash back. It's insane, and that was going on, Rick.
Well, let me tell you what happened in Arizona. In Arizona, I went down to testify for a bill to have chaplains in all these facilities, but the bill was never read in committee, so I got a beef with that. The 3 bills that were good bills were not read, and I'm still waiting to hear from the Senate president to ask him why they weren't read. I'm trying to line up a phone call with the man, but anyway, the deal is down here. The Navajo nations. There was people from Somali and other countries from Africa going around and picking up the indigenous people, Native Americans, picking them up when they go to the store, the convenience stores, and they're on drugs and they're drunk. They would go pick them up, take them to a rehab house. That's basically a house,
right?
And then against their will, and these rehab houses were getting paid $7,000 a patient to have these people in there. So they were rounding them up, bringing them against their will, getting paid by the state for $7,000 a patient. Then they would allow these people to relapse. They would have to go out and do a binge, and then to get them back in there. And now they're getting paid $12,000 a month. I met the first lady of the Navajo nations. I was so moved by the testimony of this, that this was brought out into the light of day. I went and offered her prayer. I went and prayed with her for the Navajo nations, for safety and peace for their people and Native Americans in our state and around the country. I mean, this is the type of stuff. See, we're living in like some kind of fantasy land. Oh, there's no slavery. There's no kidnapping. There's no pedophilia. They're not picking kids off the street and sending them to, God knows where. We pretend like this is like we're in some sort of a fantasy land, in La La Land, and these things don't exist. I never heard of this. Now the governor, to her credit, she has a task force that They're finally going to protect these people. But this has been going on for years. They pick these people up off the street, bring them to these rehabilitation houses against their will, cash in, have them relapse. Now, here's the sad part. When they allow them to relapse, if they died, they're basically put in a potter's field and nobody ever sees them again. This is going on in 2023. Are you kidding me?
This was going on with Obamacare, like I said, and I would never have found out about it. There was an independent movie about it, and I watched it. It was a true movie, okay, and it was about exactly what you're talking about, man. And I'm like, I couldn't believe what I was watching. And that's the same way they're dealing with the elderly in Arizona and everywhere else. It's just it's a money grab, okay, and it's a federal government money grab and state.
Pastor Sean's insurance. He went to the facility because I'm not going to get into his whole story, but he had a wound on his back. Okay. He had a wound on his back. He was on the road to recovery. He wasn't changed. He got MRSA in the wound. This started him a 4-year spiral straight into the grave because of neglect, mistreatment, and abuse.
Yeah.
His insurance, I figured it out, paid out over $2 million a year. He had to have dialysis three times a week and sometimes 4 times a week. A single dialysis treatment costs $6,000. $6,000 is what our tax money pays for a dialysis treatment. They have the machines on site. It shouldn't cost no $6,000 for a treatment. Okay, so his insurance paid out $2 million a year, and he should have been getting Hyatt Regency care and accommodations. He should have got a massage therapy bed and chair. He should have got his own masseuse, his own secretary, and top of the line entertainment. And instead, this poor man got what amounts to laying in a crack house, being fed unhealthy processed food most of the time, neglected, abused, and mistreated for $2 million a year. $2 million a year. This is what his insurance paid out.
Brutal. Well,
Alicia,
I'm going to get off.
Alicia, can you hear us? Okay, Leo.
Yeah, I can hear you.
Okay,
I'm going to get off here. I just want to say you're a great man, Paul. Okay, and now and everybody out there, my word to you is do the will of others. Okay, at all costs. It don't have to be something big, something little. Like now you got me going. Now I'm going to go bring some flowers out to the people in the old age home this weekend because I've never done that before. But that's just a little thing. Okay. And I'm going to do that and spend some time. I really I enjoyed talking to the elderly people, especially about the Korean War and World War II and their conflicts. Okay. And, they got a lot of knowledge. Don't neglect them because they're old. Okay. Because we're all going to get there and I don't want to be neglected. Thanks, guys. Enjoy, Alicia.
Okay. See ya.
Thanks, Leo. See you, my friend. So, Alicia, what's on your mind?
I am so grateful for Paul bringing this out into the open. It's so needed to be. It is just a crime on what happens in those elderly people's home. But I have a friend that I do want to defend. She's a registered nurse and she was slowing down and she went to an old people's home and was going to ask for a job, and they give her a list of stuff that she could do and she couldn't do, and one of the things right on the list was they do not get their diapers or their beds changed from 10 o'clock at night until 7 or 8 o'clock in the morning, and that was mandatory, and so she wouldn't take the job.
Where is this?
This was in Kingston, Ontario, at an elderly people's home, and I don't know if it was Helen Henderson or one of the other ones. She never really would tell me the name of the old people's home, but she just told me about the list, and so she turned them down. She said, "No, I won't work for you."
If a dog was tied to a tree and it's 115 degrees and someone recorded it, the guy that did it recorded it and made fun of it, there'd be such an outrage. Okay. There'd be thousands and millions of people marching down the street.
Yep.
But you got these people that aren't changed all night long. that opens the door for MRSA, bed sores, rashes, E. coli, blisters, infections, and other very serious complications. And you don't hear a peep. What does that tell us about society? It tells us that we reap what we sow. If we're going to not do anything, if we're just going to look the other way, we will reap what we sow as a society. I don't want to reap that type of sow. I don't want that sow. That sow can go as far as I'm concerned.
My mother was at Helen Henderson, and I know she died from neglect. And I mean, it was a good, reputable place, but she ended up with gangrene in both legs. She had bed sores on her bottom that were the size of dinner plates. And the one time I was in there, they actually took straight rubbing alcohol and poured on the bed sores and on her open wounds on her legs, because they told me that it was to keep the stench down. And my mother was just screaming and going, it's so bad, I had to get out of the room. I'll never forget that, and I'll never get over it.
Again, here's what we have to say. There are a lot of good people that work in these facilities, and there are a lot of good compassion. I know them because I know them. I know them. I see them. Okay, so there are a lot of good people. There are a lot of Christians. There are a lot of good people. There are a lot of people that are good. Okay, but there are a lot of people that are bad. There are a lot of people that are condescending, that are only in it for the money. That I've had, poor Pastor Sean, again, I'll mention him. He would call me on the phone. Chaplain Paul, I've been waiting 3 hours to get change. I can't take it. It burns. It stings. I pray with him, and then thank God someone would come in through the room. The power of prayer works. We can't push God over in the corner. We got to bring God right into the center of this issue. Okay, in the Bible, I can't believe I can't forget. Proverbs 3, 5, and 6. Trust in the Lord with all your heart and lean not on your own understanding. In all your ways acknowledge him, and he shall direct our paths. Again, it's all about trusting in the Lord and asking for godly wisdom, how to navigate through these situations. If your mom gets sick and they say, well, she's got a few years left to live, or not a few years, a short time to live, well, then take a leave of absence from work. We talk about hospice. There are very good hospices, which you got to make sure that they're being hydrated, that they're being fed. If they're unconscious or coma, that they're being hydrated. I don't want my mom dying of starvation or because she's not being hydrated. That's inhumane. I don't want that. You hydrate her, you feed her with a feeding tube, whatever, until she passes on. Or if you don't want a feeding tube because of directives, fine. But being dehydrated and malnutrition the last 3 days of your life is inhumane. So you got to make sure you ask questions. If you go into a group home, you got to make sure that the staff is big enough to lift up the patients. Group home, whoever don't know what a group home is, they take a house, they remodel it, they make it look like a museum, like a hotel, and then they have patients in there. Maybe anywhere from 5 to 10 patients are in the group home, and then they staff them with people. Well, if at night and on the weekends the staff is small framed, they can't pick up a big person. When your loved one falls on the floor, my father-in-law was in a group home. All right, I'm not going to get into a lot of horror stories. I'll just tell one for right now. But my father-in-law was in a group home before he died. He fell on his knee. They couldn't lift him back up. They had to call the fire department. He stayed on his knees until the fire department came. He was in the. This is another thing. You got to make sure that other patients can't come in to where your loved one is when they're sleeping. Why? Because there's patients with dementia and other mental health issues. A patient came into my father-in-law's room, climbed up on top of him, started pounding his chest thinking he was having a heart attack. Well, you go into a group home and everything looks hunky-dory during the day. Okay, who's on staff at night? Can I put camera in the room? One of the things you do in order to protect your loved ones is you get an Alexa app that has visual. It's voice activated. You can monitor what's going on in the room 24 hours a day. Your loved one, if they're paralyzed, they can activate it voice. They can listen to music and the news and stories and the weather and whatever, all voice activated. If he says, call mom, it'll call on the cell phone. You can monitor their situation. They come in the room, they want to do something. You can see what's going on. You want to give your mom this medication or that medication. Well, hold on, I want to do the research on it. That's another thing. When they tell you they want to give you something, do the research, look it up. What are the adverse reactions? How long has it been on the market? We shouldn't put any pharmaceutical in or on our body that hasn't been FDA approved for at least 5 years. Why? Because after 5 years, we'll know the data of who's been injured, how many people died, what the lawsuits were, and by 5 years, it would have been recalled or not. That's why with this thing, I'm not going to call it, I'm going to call it the thing. I'm Italian. Yeah. I'll call it the thing. Okay. That's why with this thing, you don't know the long-term adverse effects. So what do? Out of fear and ignorance, the greatest threat to the human race is fear and ignorance. That's the greatest threats, not the Russians, not the Chinese, not the nukes, not a meteor, not the aliens coming from Kalamazoo. It's fear and ignorance. Okay, because through fear and ignorance, we get enslaved, we get manipulated. We're too afraid to stand up for our civil rights, our patients' rights, the Bill of Rights, our constitutional rights, and we're too ignorant to know what they are. So what do? Everything falls apart, and we just listen to people. Oh, the government says this. Okay, let's do it. Oh, the government said, hey, you know what? Take this Kool-Aid. It'll help you feel better. And we all drop dead. How's that going to work for us? So, we better wise up because things are just falling apart all around us. Now, here's the good news. The good news that God is in control. The good news that this is the end times. The good news is we need to keep fighting the good fight of faith. What's the most important thing? The most important thing is our salvation. That's the most important thing. And the safety and well-being of our families, our loved ones, our friends, our coworkers, our neighbors, our fellow citizens. That's it, cut and dry. But we cannot chisel away at our rights, at our civil rights, the constitutional right. I know you don't have the Bill of Rights there in Canada, but you must have something that dictate that you could be a free nation. You had the freedom ripped out like a rug.
We were denied our freedom when Trudeau called out the Emergency Act. That took all our freedoms away. We were just like as if it was Nazi Germany. And the other thing, it doesn't matter how many staff is on night. There's a machine in there now that lifts the patients. There's no reason for those beds and diapers to not be changed other than money.
Well, it's called a Hoyer. For your list, the people that don't know what that is, it's like a little hand crane, okay? And it has like a pouch that comes to, they put it around you and they lift you up like a ball and they put you into bed, okay? Well, if you don't have the Hoyers on that floor, you're going to wait a long time. If you don't have the staff to operate those Hoyers, you're going to wait a long time. Hey, you know what? There should be a Hoyer in every room then. Put a Hoyer in every room. What you're paying $2 million a year for healthcare that is inhumane. For that kind of money, you should have a Hoyer in every room. For that kind of money, for that matter, there should be robots by now to help monitor these people, take care of these people. Huh?
I think my mother, she paid $2,500 a month, and she passed away in 2003.
Yeah, $2,500 a month. Well, a group home could cost as much as $10,000 a month. These facilities, like I said, one dialysis treatment costs $6,000. I have a dear friend. He has he's probably watching right now. I'm not going to say his name. He has a very aggressive form of MS. He told me that once a year he has to have a treatment that lowers his immune system, because when the MS kicks in, it doesn't spread with a low immune system. If you could wrap your mind around that, I'm still can't, but There's this drug. It costs $104,000 just to administer this one drug. 104 grand. I mean, come on, guys. You know, insulin should be free for everyone under 21 in the United States. For everyone under 21 should get insulin and free mental health care for everyone under 21.
I agree. If they can give the drug addicts Narcan, they can give insulin to the people.
You know, we just don't, you know, we're not getting our money's worth from our elected officials. Look, let me tell you something. If you had your house painted, okay, you want your house painted. The crew shows up. The crew does a half, sorry for a half-assed job, and it shows up whenever they want. Not only that, they break into your house, tie you up, put you in the closet, and rob you. Not only that, the police come. They write a report that's downgraded, dismissed without any investigation. Not only that, the painting crew gets paid. Not only that, they get to keep their job. I've just summed up what our health department is doing to these poor people out here. They downgraded, dismissed without any investigation, hundreds and hundreds of very serious complaints of sexual and physical abuse committed against these poor people while they're sick in the bed, being sexually and physically abused. And we can't get public hearings. We can't get justice. We can't get a system of protections for these people. It just tells me we're all on our own. We're completely on our own.
Well, I put in the chat, about, I don't know, 4 or 5 years ago. I think it was a mentally challenged Native woman, but I'm not sure. All of a sudden, she started getting fat, and they didn't figure out that she was pregnant until she started giving birth in the home.
It was the hacienda. It was the hacienda facility here in Phoenix or Mesa.
Okay.
And the people were outraged.
Yeah.
Huh?
Yeah.
It was in Arizona. It's called hacienda. Okay. There was a patient, semi-coma patient who was sexually abused and became pregnant.
Yeah.
This outraged everybody, and Representative Longden put together the long-term care committee for neglect, abuse, and mistreatment of vulnerable adults in Arizona. I spoke in front of that committee. All right. The problem is the committee doesn't have both Democrats and Republicans on it. There is no long-term care caucus. There is no long-term care caucus. There is no long-term care joint legislative committee. There is no long-term care task force to go into these places that would be created by the governor and directed by the attorney general. There isn't any of that. But you got a caucus for every other thing under the sun, but you don't have a long-term care caucus in the state of Arizona. And then when I ask people this, I don't get any real answers. So in my world, I'm just going to keep fighting. That's my world. And that's what I'm going to do. I've lost too many people I loved. I've seen people I loved that were just treated horribly, and then Pastor Sean dies, and Thomas died, and Lori died, and Greg died, and Luz died, and on and on and on and on. And like I said, it's just ridiculous. How many people have to die that I love before our elected officials do something? I mean, for God's sake. And then we had another tragedy in our family. We lost our son-in-law. Like I said, my 2 dogs died over the last week. I mean, my God, you wonder why I'm not an institutionalized myself, Yeah. I mean, I'm serious. So the deal is, only by the grace of God do I even have the ability to do this. But to everybody listening, you put your faith and trust in God. Trust in the Lord with all your heart. Lean not on your own understanding. In all your ways, acknowledge him, and he shall direct your path. Ask for godly wisdom. Ask for God to direct you and guide you through the maze of our healthcare system, and then do real research. Don't take things for granted. Get second and third opinions. Look at alternative forms of treatment, medical marijuana, Asian forms of healing, acupuncture. There's stem cell research. There's clinical trials in in universities. It's free. If you have a health problem, look online, see if there's a university near you, and see if you could be part of a clinical trial. You know, all of these things, holistic healing. We're not bound by pharmaceuticals and traditional medicine. We have a whole bunch of options. The problem is we're not educated. The problem is we were told by mom and dad, do what the doctor tells you, and be a good boy. Well, you have to question authority, and you have to understand your body is one of a kind, and what's right for this guy may not be right for you. Know your body, know your treatment, know your options, and do real research so that you could be. There's a saying: if we're educated, we're equals. If not, we're a victim. That goes with everything. You bring your car into a mechanic to get work done. If you're educated, you're an equal. If not, you're a victim. If not, you're going to spend $3,000 and you could have got away with $20. So, you know, that's what you need to do. You need to educate yourselves. You need to pray. You need to talk. You need to have a willingness to go out and serve and to help others. And that's what we need to start talking about and doing. That's it, you know.
So, Alicia, can I get you to just give us some final thoughts as we sort of wrap up with you?
Well, there's a new virus coming out, so get prepared for it. It's called the Caraman Congo something fever, and
hemorrhagic.
Yep, and I asked my nurse friend. I said, "What's that?" She says, "Basically, you bleed to death."
Swell.
Yep. And apparently, it's a kill rate of 60%.
What's the name of this again? What do we have to look forward to?
CRIMEAN.
CIR.
No. CRIMEAN. CONGO, and then
hemorrhagic
fever. Yep.
That sounds fantastic.
Hey, Rick, next time you have me on your show, I'll probably have to take a sedative because it's too much for me. No, listen, here's the thing. If you ever have me on your show again, Rick, we'll talk about, like, you know, my experience in prison and how you know, a lot of the things that I witnessed, people healed of hep C, diabetes, cancer, relationships restored, money falling out of nowhere, all through the faithful prayers of the brothers in Christ at Kingman State Prison. We could talk about that. We could talk about, you know, other things. If every time I come on your show, we talk about this particular issue, it will probably just depress people right into the bottle. So we want to kind of mix it up a little. Okay.
Yeah, absolutely. You know, I have noticed that. I think you're right about people not wanting to hear about this, because I see that the numbers tonight on the number of viewers it's actually down a little bit. And I thought that people would have heightened interest in this subject matter, but it is pretty depressing stuff. And people don't like to look at the darker side of life. And honestly, a lot of people like to just try to avoid the issue of end of life.
Well, it's not the end of life. Okay, as believers, this body may fail, but it's the beginning. Okay, so it has to be looked at not as the end of life. We have to look at it like leaves falling off a tree. We have to look at it different. We have to have a different perspective about this. We have to say, look, we're all gonna pass on someday. Let's try to make it, you know, as pleasant as possible, please. Let's try to help people along the way so they get the love and compassion and care that they need if they go into these facilities. And let's try to help be there for people and not isolate them. And let's try to, you know, have remind ourselves of what's written in the Bible, that it's not the end. Okay, so we don't have to worry about that. Death is not the end. What we're dealing with here is the process of getting from point A to point B, which can be very, very difficult and heartbreaking and inhumane. And we can work together to help, if nothing else, educate people on how to protect themselves, at least to wake people up to the fact that you weren't put on this earth to be a millionaire. You weren't put on this earth to go gather material wealth like a pack rat at everybody else's expense. We were put on this earth to love the Lord Almighty with our heart, soul, mind, and strength, and to love others as Christ loves us, to love our neighbor to love thy neighbor as thyself. This is why we're put on this earth, to help relieve pain and suffering, to help make this world a better place so we can leave it to our children and grandchildren as being a better place. We're not doing that. It's all like everybody's out for themselves. It's like a sinking ship, and everybody wants to save themselves. They don't want to work together to fix the hole in the boat. You know, oh my God, the boat's sinking. What do we do? Oh, I got to grab my stuff. I'm going to grab my stuff. Get out of my way, buddy. And you're pushing and you're shoving everybody. When the solution was, hey, let's stop, leave this stuff. Let's work together and fix the hole in the boat. Well, that's what we're talking about here, folks. Let's stop pushing everybody out of the way and trying to save ourselves. Let's fix the hole in the boat.
Yeah. So Alicia, can I ask you a question? Where did you hear about this this new virus? Because Crimean Congo hemorrhagic fever had been around for quite a while. Is there something new about this?
It was on Redacted, and apparently somebody in France just died with it. And of course, they were saying on the show that it's going to be coming this way, folks. Get ready for it. But the good thing is, the unvaccinated were safe. Apparently, it's only really hitting the vaccinated.
I see. Well, I'll have to find out more about it, I guess.
Yeah, it was on Redacted last night.
Oh, well, okay. I'm not going to lose any sleep over it tonight.
No, I'm not either.
Maybe if I read more about it, I'll get really scared and lose sleep tomorrow. But I'm okay right now. Oh my, yeah. I mean, I looked it up, and Crimean Congo hemorrhagic fever has been around for quite a while.
I think they said, yeah.
So what are they saying about this? That they're suggesting that in people with a compromised immune systems because of a certain thing that maybe they had administered in their arm have made them vulnerable to this? Is that the idea?
No. They just said that because of that, it's lowered the immunity system.
Right. That's what I said.
That if it travels the same way as the other virus, somebody is going to get on a plane that's got the symptoms. And this is just what I'm assuming. They didn't assume anything other than this person died in France, and they said it came from Africa, and now this one person in France has got it. So if somebody has been exposed to it and gets on a plane, it could get around.
Well, we'll see. It's been around for quite a while, so I don't know.
COVID has too, because I looked at one of my vaccinations that I give my calves, and the COVID is in the vaccinations and has been in there for the last 4 or 5 years.
Well, we better stop talking about it lest we get banned off YouTube.
Okie dokie.
And every other platform out there. Anyway, thank you, Alicia. I appreciate your time tonight.
Okay, thank you. And thank you, Paul.
Yeah, talk to you again.
Really okay, bye.
See ya. Well, there you go. Paul, thank you so much for joining us on the program. Is there anything else you'd like to add or think that we might have missed?
There's a whole bunch of stuff, Rick, but you know what? We'll save something for next time, hopefully, God willing. Like I said, I have a lot of stories of what my experience was in prison with being a pastor, head pastor of the South Yard. I have witnessed miracle after miracle after miracle, and I could share some of those stories with you sometime to bring hope to people. Then there's the stories of some of the things that I've witnessed in the facility. Not all bad. Patients healed through the power of prayer. Thomas went to heaven. We could talk about him. My friend went to heaven. He died for 35 minutes. It's an extraordinary story. He did eventually go home to be with the Lord last year. But he was my friend. I loved him. I know his story inside and out. That will bring a lot of hope to people. So, whatever you'd like to do, my friend, and you have my number, and my phone, sir, is open to you. If you need prayer, if you feel that the forces that be are coming down on you, you call me and we'll pray together over the phone. If you have somebody in your family, sir, that winds up in a hospital, or God forbid something happens to, is sick, you could call me and we'll pray over the phone. And that's a promise from Chaplain Paul. Okay.
Thank you. Thank you, Chaplain Paul.
And you have a very blessed night. Oh, I'm sorry.
Yeah, and I truly appreciate your time here, and we will absolutely have you back.
You have a very blessed night, and to everybody out there, Jesus loves you, and so do I. Have a very blessed night, sir.
Yeah. Oh, one last thing.
Oh, okay.
When people use their superpowers for good and not evil around here, we knight them. Here we go, Sir Chaplain Paul.
We, the Maverick family, do hereby dub thee an official Maverick Knight, freedom fighter extraordinaire. May your courage and devotion to freedom and truth become a shining example to the people of our world and the Maverick universe. Maverick News. The world is watching.
There you go, sir. I think we kind of did that before, but I'm glad to have you part of the family.
Am I still on?
You're still on.
Oh, I'm sorry.
Yeah,
I thought I was off, Rick.
No. We just knighted you.
Dance, I thought after the dance, bada bing.
No. We knighted you, and I just wanted to say thank you again. And
well, that means a lot to me.
Yeah, and we're happy to have you. As a knight, an official knight now of the Maverick family, and we'll sign off now because I have to get through the news of the day, which is normally at the beginning of the program, but tonight I'm going to deal with it at the end. But thank you, Chaplain Paul.
Have a blessed night. Bye-bye.
You too. Okay, folks, and I will be right back, and we're not going anywhere yet. We still have a little more ground to cover as the show continues with the news of the day. Don't go away.
Greetings, brave Mavericks. Our quest for truth continues. We go beyond fake news. Together we expose propaganda. Together we pull others out of rabbit holes. We are maverick thinkers. We are all unique individuals, defenders of individual rights and freedoms, credible, trusted, grounded in reality. Maverick News. Defending free speech. Donate at freedomreporters.com. Do it now. Tomorrow may be too late. Maverick News. The world is watching.
I am back, and I do have some stories to talk about still tonight. In Nevada, authorities have made a significant development in the long unsolved killing of renowned rapper Tupac Shakur, who was murdered nearly 30 years ago. The Las Vegas Metropolitan Police Department confirmed that a search warrant was served this week in connection with that case. Tupac was a prominent figure in the world of hip hop and was fatally shot on the night of September 7th, 1996, during a drive-by shooting in Vegas. He was only 25 years old. On Monday, law enforcement executed the search warrant in the neighboring city of Henderson. Those specific details regarding the nature of the search and its location still remain undisclosed this evening. Aiden Ocampo Gomez, spokesperson for the Las Vegas Metropolitan Police Department, provided limited information during a brief phone call, citing the ongoing investigation as the reason for withholding further details with media this week. The tragic incident occurred when Tupac was sitting inside a black car alongside Marion Suge Knight, the head of Death Row Records. The vehicle had come to a stop at a red light near the Las Vegas Strip, and then a white Cadillac pulled up beside them, and gunfire erupted. I remember there was a really good documentary about this that I watched a few years ago. Sorry, I can't remember the name of it, but you might want to search for a documentary regarding this online. Tupac sustained multiple gunshot wounds in that incident and was taken to hospital. He was in the hospital for a week and then finally passed away. Despite extensive efforts, there were no arrests ever made in connection with the case. The investigation faced significant obstacles in the past, with witnesses refusing to cooperate, leading to a swift end in progress, as stated by Las Vegas police. So it's worth noting that Nevada does not have a statute of limitations for prosecuting homicide cases. This means that justice can still be sought in this case, regardless of how much time passes. Tupac's impact on the music industry, as I'm sure most of you are aware, really can't be overstated. It's not really my kind of music, but that's just because I'm getting a little up there in years, I guess. He was regarded as one of the most influential and versatile rappers of all time. He received 6 Grammy Award nominations throughout his career. His discography includes 5 albums that reached #1 on the charts, including Me Against the World in 1995, All Eyes on Me in 96, and posthumous releases such as the Don Killuminati, The 7-Day Theory in 96, recorded under the name Machiavelli, as well as Until the End of Time in 2001 and Loyal to the Game in 2004. So we'll keep an eye on this. It looks like there might be some developments on that front 30 years after the fact. On the Donald Trump front, the Michigan Attorney General has taken action against 16 fake electors, as they're calling them, for their alleged involvement in a post-2020 presidential election scheme. Attorney General Dana Nessel has announced these charges today, and Nessel has charged each of the state's electors with multiple felonies, including conspiracy to commit forgery and forgery itself, and there are other charges as well. So according to these allegations, the 16 electors secretly gathered in the basement of the Michigan Republican Party headquarters on December 14th. They signed several certificates, according to these allegations, falsely claiming to be duly elected electors. So then these documents, which they say are fraudulent, were then sent to the United States Senate and National Archives as part of a coordinated effort to award the state's electoral votes to their preferred candidate instead of the candidates chosen by the people of Michigan. The investigation into this matter is still ongoing, and a press release has been issued in which Nessel states, quote, "The actions of these false electors have not only eroded the public's trust in our elections, but we firmly believe that they have also violated Michigan's election laws. Throughout my time," it says here, "as Attorney General, my department has prosecuted numerous cases involving violations of election laws." It goes on and he says, "It would be a grave failure on our part if we did not take action in this case, given the overwhelming evidence of an organized attempt to undermine the legally cast ballots of millions of Michigan voters in a presidential election." Isn't it interesting that in this case, they're seeking prosecution and have actually laid charges? But on the other side of the political aisle, as these questions about election integrity have been raised, everything just kind of got shoved aside, didn't it? The 16 individuals identified as fake electors are Kathy Burden, William Choate, sorry, I can't pronounce the name, 72 years old, Amy Facinello, 55, Clifford Frost, Stanley Grott, John Haggard. See, they're going out of their way in this release to make sure they name them all. Marianne Henry, Timothy King, Michelle Lundgren, Michonne Maddock, James Renner, Mayra Rodriguez, Myra probably, Rose Rook, Marianne Sheridan, Ken Thompson, 68 years old, and Kent Vanderwood, 69. All a bunch of older people. So you should note that Nestle announced the reopening of the investigation into these allegations of being fake electors on January 6th, which coincided with the second anniversary of the incident at the U.S. Capitol. Coincidence? I don't think so. So keep an eye on that one too. That will develop over time. And how could it be anything but political? Something dealing with politics. Mixing the justice system and the political system. I smell something. We'll be right back, and we'll show you Joe Biden sleeping. It'll be entertaining.
Maverick News. The world is watching.
Okay, so Joe Biden was in this meeting today at the White House, and this is a close-up. I'll show you the close-up first. He's mumbling, but it looks like he's actually sleeping while he's doing it. I've never seen anything like this from a world leader, honestly. I use the word leader loosely here. Just listen and watch.
Israelis and Palestinians together at a political level, and Israelis and Palestinians together at a political level,
like seriously. Okay. Okay, here's a wider shot. So here he is. This is the wide shot with him meeting with Israeli President Herzog. I'm flabbergasted. I can't believe the people are putting up with this. I mean, like, honestly.
And we brought Israelis and Palestinians together at a political level, and Aqua and Shram.
Yeah.
And as I affirmed the Prime Minister, and we brought Israelis and Palestinians together.
I mean, I know he is talking, so I guess he's awake, but he looks like he's half asleep. Literally looks like he's half asleep. It just blows me away. Anyway, so the U.S. government has launched its cyber trust mark. I'm not sure if this makes me feel any better, honestly, but this is the Internet of Things, IoT's cybersecurity labeling program. It's supposed to protect Americans against a myriad of security risks, which are associated with internet connected devices. So this program, the official name is the U.S. Cyber Trust Mark. So they're going to put like a logo, I guess, on various electronic digital devices that connect to the internet. And it's aimed at helping Americans who are out there buying consumer electronics goods. And this is supposed to help ensure that, you know, they can have confidence in buying these internet connected devices that will include strong cybersecurity protections against cyber attacks. So the Internet of Things, which is a term encompassing everything from fitness trackers, Wi-Fi routers, baby monitors, smart refrigerators. I even have a door lock here that connects to the internet. I don't know how secure that's supposed to be. Wasn't my idea to buy it. I had nothing to do with it. Don't even like it. But anyway, it's these things. These things have long been considered sort of a weak cybersecurity link. Exactly why I don't want it. But anyway, many devices ship with, these easy to guess default passwords, and many of them have a lack of security updates. So these things put your entire home network at risk. It puts everything you have actually at risk. It can. So what hackers can do is pull up in front of your house and actually hack into your Wi-Fi and then into other devices that you have by going in through like a wireless printer, or maybe even your refrigerator if it's connected to the internet. If they really wanted to. I mean, I don't know if anything I have here is that sensitive. But anyway, the government says its voluntary Energy Star influence labeling system, the Energy Star logo that they put on appliances to show that it meets certain energy efficiency standards. Well, this new system is supposed to raise the bar for security for other consumer electronics goods which connect to the internet. And they have a certain level of standards. Today, they had a roundtable discussion. And I've just got a brief clip lined up here for you where they kind of summarize where things went today. And here we go. Let me just bring this up so we won't stay with it for very long at all. Just a brief clip. Excuse me. And here we go.
We are very excited to represent them today and humbled to be here. Thank you for your support.
Thank you very much. So today is just the beginning, and I want to highlight some additional work that will be undertaken as next steps. First, by the Department of Energy, including its national labs, to develop security requirements for smart meters and inverters, both essential components of the clean, smart grid of the future, and both key to protecting the nation from a cybersecurity perspective. We know smart meters both power homes and potentially could be used to disrupt one home or many homes. So a cybersecurity standard that is deployed for smart meters is absolutely critical to the cybersecurity of the nation. Finally, secondly, NIST will be undertaking an effort to define a specific standard for routers, complex devices, which are often hacked by malicious attackers and used to conduct next stage and more sophisticated cyber attacks. So we're grateful to NIST for this next level of cybersecurity standard. And finally, to the Department of State, who will work, as a number of speakers have noted, to ensure mutual recognition of standards, because our aim is that secure products can be sold globally to consumers around the world. As I mentioned earlier, President Biden is keenly focused on helping Americans be safer online. And today's launch is the result of hard work by a number of agencies. It all boils down, though, to people's persistence, people's dedication, as we heard earlier. So I'd like to take a moment and thank a number of key individuals. First, of course, to Chairwoman Rosenworcel and your team for the work happening at the FCC, specifically Priscilla Argueras, Deb Jordan, and Paloma Perez. Second, of course, Director Lacazio, and the work that's happening at NIST, specifically that of Kat Migas. Finally,
anyway, we'll just pull out of that, but while she does her thank yous, but this is a subject that should be top of mind for a lot of people. Really, it needs to be focused on more. And when you're out there purchasing these devices, I mean, I know people are really concerned about things like the CBDC, the central bank digital currencies, but it's actually these devices too. Anything that connects to the internet in your home, whether it's a thermostat or your Wi-Fi router or your computer printer, all of these things uh, represent potential security risks for you. They allow for all kinds of tracking and data accumulation on you so that they can then sell the information on you. And it's those kinds of devices also that allow for ultimately control through social credit programs. Yeah, I mean, they're going to grade you on how much energy you're using, where you set your thermostat, all of those kinds of things. So if you have, this smart technology in your house, that gives all kinds of companies access to data and all kinds of information about you that they can then use to market to you, control you. That's really what it's all about. It's about, like they say, you are the product they're selling. And then, Chaplain Paul mentioned that the temperature today down in Phoenix, Arizona was 115 degrees. That is smoldering hot, man. That is really, really hot. But it's not I just looked it up, and it's not the hottest day on record ever in Phoenix. I guess the hottest day ever in Phoenix, Arizona was recorded back on June 29th, 1994, when the thermometer reached a peak of 128 degrees. I mean, I've never been any place where I've experienced heat to that level, 128 degrees. But that was, in one spot in Arizona. Yeah. And they've really never gotten that as close to that temperature again. But 115 degrees, I'm not sure, but I think 115 might be close to the hottest day so far this year down there. So I guess that temperature of 128 degrees was recorded in Lake Havasu City in Arizona. And there's some dispute which day the 128 degree temperature was reached. So back in that day, around that time, the fire department personnel did regular weather observations at 5 a.m. So on the morning of June 29th, 1994, they reported to the National Weather Service this 128 degree temperature. And it was that date that I guess got stuck in the official record books. I don't know how important it is that it be a specific date, one way or the other, in the overall scheme of things. I guess it matters to some people. But a lot of people, will tell you who live down there that it actually reached 128 degrees on the day before, June 28th. 128 degrees. Holy smokes, like literally, holy smokes. Wow. Oh, boy. If you want to support this channel, you can do that by donating at freedomreporters.com. Where did the banner go? Let me get that graphic up here for you folks. We added some new ones to the mix tonight. So as a result, everything is a little messed up. There it is right there. freedomreporters.com. Or that'll take you to the PayPal page. And you can also donate at maverickdonations.com. That's the Give, Send, Go Christian-based organization. Love those guys. They're fantastic people. Amazing the service they provide, actually. As I told you, when I set up that account, they actually phoned to say thank you and pray for me. It's like, No one's ever done that for me, like no company. So they're a pretty exceptional organization, Give, Send, Go, I have to say. And they stood up for the Freedom Convoy too. They did. When the GoFundMe thing kind of went sideways, Give, Send, Go stood up and said, hey, you can't touch the money here. But that's a whole other story. They did get hacked by that Aubrey guy. But anyway, that's another story. freedomreporters.com. Also, please consider liking, sharing, subscribing. Please consider subscribing over on the Rumble channel. I did put the link to tonight's broadcast in the description. In fact, I'll put it in there again in the chat right now. So you can head over to Rumble and subscribe over there if you are so inclined. That's the free speech platform where we are growing. It's vitally important for us to stake a claim over there, an internet land claim of sorts. That's our little space over on Twitter, on Rumble. And we're on other platforms too, including Twitter and Cloud Hub and Gab and these others. But Rumble's the other big one. YouTube, we're firing on all cylinders there again too, but we're still demonetized. Well, I don't think they'll ever remonetize us. Highly unlikely. Not that they were really giving us very much over there anyway, but we get zero again, not monetized on Facebook. We're still on a ban on Facebook. Not sure what's going to happen there. But yeah, please, if you do subscribe on YouTube, please hit the notification bell. That is going to do it for us tonight, folks, here on the Maverick News Channel. Thank you, Maverick family, for spending the night here again with me and with our special guest, who I'm also grateful to for spending time with us here tonight, Chaplain Paul. I will be back tomorrow night, 6 p.m. Eastern Standard Time. And we have a special guest, I believe, coming up later this week. I won't, because it's not confirmed. I don't like to do that until he's absolutely confirmed. I'll tell you about it tomorrow. So if you want to know who our special mystery guest is going to be later this week, you have to tune in tomorrow to find out. I will be back 6 p.m. Eastern Standard Time. Love y'all. Catch you on the flip side.
This has been a Maverick Multimedia production.